won't you take my hand? I built to my sky, I need some history built. But I swear it feels real when you take my hand. My passenger side. All eyes on you, setting lights for such a beautiful world. We're so high, I'm with you, hypnotized. I'm in such a beautiful world. It's like I'm living my dream.
You can be the greatest, you can be the best. You can be the King Kong banging on your chest. You can beat the world, you can beat the war. You can talk to God, go banging on his door. You can throw your hands up, you can beat the clock. You can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame. And the world's gonna know your name. You burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
You can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be a hero, you could get the gold, breaking all the records you thought could never be broke. Do it for your people, do it for your pride. How you ever gonna know if you never even tried? Do it for your country, do it for your name, 'cause there's gonna be a day when you're
standing in a Hall of Fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
You can be a champion, you can be a champion, you can be a champion, you
of the Hall of Fame.
Past failures may haunt you, you yourself may doubt you, but don't let none of it discourage you and stop you, block you from reaching your goals. Just believe in your own capability, ability to aim for the stars. You will overcome this war, you'll be licensed to heal and be licensed to help. This is for your mama and this is for your papa. Know that pain is temporary, but your license
Standing in a Hall of Fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame. You could be the greatest, you could be the best, you could be the King Kong banging on his chest, you could beat the world, you could beat the war, you could talk to God, go banging on his door, you can throw your hands up, you could beat the clock, you can move a mountain, you can break rocks, you can be a master, don't wait for luck, dedicate yourself and gonna find yourself standing in a Hall of Fame.
Okay, good evening, doctors. Can you guys hear me? Okay naman? Okay naman ang audio ko? Okay. Can you guys hear me? Okay. Good evening, Doc Broly. Sige, let's start with the prayer before we start the session. Let's all remember that we're in the most holy presence of the Lord. Lord God, once again, we thank you for this time, for this opportunity of learning. Lord, thank you for bringing us this far. This is the last Quizmaster session and summary lecture for this season. May you continue to guide us, to give us excellent health and motivation that we need to pass the board examination. All this we ask in your most precious and holy name. In Jesus' name we pray. Amen. Good afternoon, Doc Broly. Good evening na pala. Good evening, Doc.
Good evening, everyone. Let me share my screen. Pahingin ng co-hosting ability.
You're already the co-host, Doc.
Okay, thank you. So welcome to PrevMed, guys. For PrevMed, we have two collections, relatively minor. One is in the title. So go to page 11 of your handout, okay? Collection dito sa part na to, observational analytic studies dapat, okay? Not observational descriptive studies. So just change the title to analytic, okay? So page 11 of your handout. The next collection has something to do with the drawing, okay? Page 69, yung sa genogram drawing, okay? Kindly follow the one in the lecture. Hindi nag-correspond properly yung lecture video dito sa handout. So firstborn for each of the generation farthest from the left, siblings in right, order of birth to the right. So follow the one in the lecture, not in the handout. Okay, just correct that. So those two are the corrections for this subject. Let me discuss now. Nakuha ba to? Analytic studies for page 11, just the title, just change it. And then yung for the genogram, page 69, just place an asterisk, follow the one in the handout. Okay? Next, do we have the PrevMed team here already, Ian?
I believe so, Doc.
Okay, so yung PrevMed team, nandito silang lahat. Kindly help me explain your clarifications here. Okay? So two corrections and several clarifications. So questions sent by the students regarding the main handout or the main lectures. Okay? So regarding the productive working age group found in the handout, page 14, left upper quadrant, nakasulat doon 15 to 65 years old. Pero yung dependency ratio, 15 to 64. So nalito yung mga estudyante. Okay, Doc, bakit may 15 to 65 then bakit may 15 to 64? Dr. Louie, can you explain this properly?
Yes. So when we define the life period ng mga working, according to the literature, ang maximum range talaga, upper limit natin is 65. So when we are talking about life period alone, tinanong lang kung ano yung ages that is economically productive, you think about 15 to 65 kasi we are including yung upper limit na 65. Pero according to the Philippine Statistical Authority, if you're going to compute for the dependency ratio, we will use the formula 15 to 64. So ayun yung
Okay.
ating clarification with that.
I think nasa ano to, parang formula, di ba? Itong dependency ratio na to. Parang siya yung denominator.
Yes, siya yung formula 15 to 64 kasi ayun lang yung in-account ng PSA. Pero literatures kasi ang ginagamit nila for the life period ng mga working economically stable or working productively 15 to 65.
Okay. So tama yung nasa handout, nakakalito lang kasi may 64 yung isa tsaka may 65. Okay. Next, this is status nominal or ordinal. Okay. Halimbawa, cancer staging. Doc Mavi, are you here?
Yes, ma'am.
Nako, nag-people power yung Preventive team. Okay. Pa-explain tong part na to.
I think that I've mentioned in the lecture that disease status would mean presence or absence of the disease. The question originally was if it was cancer staging, would it be would it be ordinal? Yes, it would be ordinal kasi meron kang ranking no nung cancer stage mo. Pero for my lecture, it's just presence or absence of disease. So nominal yung variable na yun.
Yung cancer staging.
Yung ano ba, yung pagkakagamit ko ba yung disease status?
Disease status. Okay, sige. Next. Diabetes mellitus screening, is it 45 or 35? Okay. If you look at your flashcards, ang nakasulat doon ay 45. But if you look at your handout, it is 35. This is something to do with the updates nung 2022. Okay? Nag-update yung ADA. Okay, na minove nila earlier to 35. Unfortunately, yung flashcards ninyo, they are based on previous board exam questions. So, nung time na gina-clinic yung flashcards nyo, wala pa doon yung option na 35. 45 yung meron kasi yung flashcards na yon dealt with the board exam questions before 2022. So, if I remember it correctly, parang 2020 or 2021 yun. So, hindi na umabot, obviously, tsaka wala doon talaga sa choice. Okay, originally may choices yan, pero sa flashcards format, kinuha na lang namin yung tamang sagot. So, Doc, what will happen in the med boards? In the med boards, if they repeat the same question that they asked 2 or 3 years ago, if the choice 45 is there, pero walang 35, you will choose 45. Okay? Ibig sabihin, ni-repeat nila yung question from 3 years ago. Kung nandoon na yung 35, okay, you will choose 35 kasi yun yung pinakabago, 2022. Okay? Next, standard regimen for drug-resistant tuberculosis. So one student pointed out that, Doc, mali yung pagkakasulat dun sa handout. Itong parang gibberish yung nakalagay, ZKLM, FX, PTOCS for the treatment. Okay, so this is not actually a typo. This is not gibberish. This is actually an abbreviation. Okay, sa ilalim actually nung screen cap na to, nandun yung legend for the drugs that it stands for. Okay, so this is not a typo. It's lifted from the TB MOP 5th edition. It's an abbreviation, the legend of which makikita dun sa ilalim ng handout. So if you look at page 47, itong part na to, legit yan. Hindi yan pinili ng mga teachers ninyo. Yan talaga yung nomenclature na ginamit. Okay, doon sa actual reference. Next, very interesting. We actually had to consult both the IM team and the PrevMed team regarding this. TB meds and renal failure, which is more nephrotoxic and should be discontinued. Okay? So, Dr. Michael Verata, can you explain itong ano ninyo nila Dr. Magallanes? Magalinda yung anuhan nila rito, discussion nila regarding this one.
Hello po. So apparently po may differences po sa TB-CPG versus sa DOH NTP guidelines na 6th edition. So basically sa 6th edition po, sinasabi po na yung student po kasi tinatanong niya kung i-discontinue daw po yung rifampicin and streptomycin. Sa streptomycin, i-discontinue talaga siya sa patients with renal failure kasi proven na nephrotoxic yon kasi aminoglycoside. But for the rifampicin, ang sabi sa NTP na ang rifampicin is biliary excreted, meaning sa stool siya. So hindi siya na-excrete sa renal. So there is no need to change yung dosage no sa patients with renal failure. And also we consulted po dun sa IM na team, no? Ang sabi nila na yung cause of renal failure in patients taking rifampicin is not dose related but due to an immune mediated deposits. So if ever na yung reason mo is to discontinue yung rifampicin dahil sa dose, hindi siya mag-e-effect kasi immune-mediated yon. So, for PrevMed exam, no, and also sa IM exam, it's best po to use the DOH NTP6 guidelines.
Okay. And then here, another interesting thing, HIV transmission risk, blood transfusion versus sexual contact. MM, can you discuss this one?
Hello, everyone. Good evening. So, ang idea kasi is nalilito yung student na nagtanong, no? Kasi ang sabi daw sa IM handout, blood transfusion is the #1 risk. And this student attended the face-to-face PrevMed class daw. And ang sabi daw doon, ang pinakamataas daw na transmission is unprotected sex. Actually, both naman are true. Kailangan lang i-contextualize natin, no? Kasi remember, mas mataas talaga yung chances na makakahawa or makakakuha ka ng infection ng HIV kapag blood yung na-transmit sa'yo, meaning through blood transfusion or through sharing of needles. That is why mas pinapaigting yung mga blood transfusion protocols natin, pati yung mga protocols natin in needle stick injury. So in terms of yung risk, kung higher yung transmission, yes, blood talaga yon. However, in statistics, I actually discussed this in my lecture also, ang most common cause of being infected by HIV nowadays is sexual contact, especially yung male-to-male na sexual contact, primarily because yun yung highest reported cases of HIV infection. Kasi nga, lesser na yung chances magkakaroon ka ng HIV due to blood transfusion and needle stick injuries. Ayun lang.
Okay, so may fine print regarding this one. So parang risk yung isa, parang cause yung isa. Tama ba? Pagkakaintindi ko? Okay. And that's it for the corrections, clarifications that we have for PrevMed. Okay. Let's begin with the summary lecture for this subject. Okay, kindly introduce and do I think all of our teachers for the PrevMed are here just to say hello. Dr. Louie, introduce them, okay, to the audience.
All right, good evening. I am really excited to introduce you the PrevMed team. So, syempre starting with me, who discussed the epidemiology part of the handout and the lecture videos. And then we have here Dr. M.M. De La Rosa. And we have Dr. Manuel Vidal, biostatistic teacher. Dr. De La Rosa is family principles plus DOH programs. And then we have Dr. Michael Verata, the new addition sa aming team. Siya ang nag-discuss ng public health and some of the DOH programs and the miscellaneous topics. And unfortunately, hindi yata makakahabol si Dr. Mads Abraham. Siya naman yung nag-discuss ng preventive medicine. So we'll be helping you and guiding you tonight para talagang maganda ang ending ng ating summary lecture for preventive medicine and public health. So go, go, go. Doc Ian, I'm good.
Okay, so start na ba? Okay. Okay, go ahead, Doc Louie. Take it away.
Ayan. So Doc Ian, nakikita naman yung screen ko, no?
Yes, Doc.
And the pointer. All right. So again, good evening, everybody. I'm really excited to see all of you, especially ang ating mga TFC subscribers dyan sa portal. Hello, hello, hello. Let's celebrate tonight because this is a last summary lecture and I believe tomorrow is the midterm exam. Lahat na ng lectures na panood natin, lahat na ng handout na basa natin, lahat na ng practice test 1 and 2 na sagutan natin for the midterms. Let's just enjoy and apply your knowledge. So we'll be having a different format for the summary lecture of this subject since I wanted to have you a sustained attention. We'll be tackling a lot of questions here na previously na-encounter ng maraming students in the board exam. And I'll be sharing some of my experiences also. All right, so let's begin with the first question. There. So stage of subclinical disease extending from the time of exposure to onset of disease. So we are now talking in the context of the natural history of disease. So you can chat your answer if you want to share it, but this time we're just going to review it and make sure na yung mga important concepts makover natin. So ang tamang sagot dito sa question na to is your incubation period. So bakit natin tinanong to? Kasi lagi nilang tinatanong sa board exam ito. And when we talk about incubation period, importante itong image na to that is included in your handout. Now when we talk about incubation period, remember, pwede siyang magkaroon ng permutation like the latent period. Ano ba yung difference ng incubation period sa latent period? When we talk about incubation period, we are pertaining to infectious diseases. Pero kapag latent period yung na-encounter nyo, it is pertaining to chronic diseases. So again, ang incubation period mo is under the subclinical disease. But you need to remember also yung different stages like the stage of susceptibility, clinical disease, and up to death. Now you need to remember to relate it to the levels of prevention. So remember, easily lang, no? Ang level of prevention, pag sinabi nating primary prevention, ang ating index case or ating population, wala pa silang sakit, wala pa silang outcome. Okay? And then for the secondary prevention, okay, usually it's asymptomatic under the latent period or under the incubation period. Kaya nga ang pinaka-common na tinatanong sa secondary prevention is your screening. And then for tertiary, we're just trying to prevent the progression or having the complication of a certain disease. And we'll be applying that more sa susunod na mga question. Next question natin is epidemiology topic. Okay, so sumagot tayo lahat. What term is used to describe a widespread outbreak of a disease that affects a large number of people within a population, community, or region? What's our answer there? Ayan, sige. Habang sinasagutan natin to, can I ask Dr. Mads Abraham to open cam and say hi to our students para na makita nila na kumpleto talaga ang pre-med team? Nandiyan ba si Doc Mads? Doc Ian, pwedeng naka-spotlight ba ako? Nandiyan na si Doc Mads. Ayan, sige.
Yes, Doc, naka-spotlight ka. Good evening, Doc Mads. Is she here? I don't see her.
Wala ba?
No, she's not here.
Okay, sige, sige. Alright, so let's try to answer this. Ano yung mga sagot natin? So kung sinagot mo dito, epidemic disease, congratulations, tama ka. Okay, so kung narinig mo yung word na outbreak, okay, that is a similar definition. May outbreak tayo, may epidemic. Kaso ang pinagkaibahan lang nila, when we are talking about epidemic disease, we are dealing with a large geographical area of responsibility. So kapag sinabing community, region, a bigger population, much better isagot ang epidemic. Pero kung confined lang ang geographical area like a small barangay, a village, no, better to answer outbreak. Now let's discuss the different terminology here. When we talk about sporadic disease, all right, we are dealing with few and unrelated cases. So Ayun yung sporadic natin, paminsan-minsan lang. Pag naman endemic, constant ang occurrence niyan, and usually mababa lang yung number of counts or frequency. Yung best example natin ng endemic, dalawa yan. In Palawan, we have malaria. And then in Samar, everybody answer, all right, very good. It's your schistosomiasis. Ano naman ang hyperendemic? Hyperendemic refers to a persistent high levels of disease occurrence. And then, holoendemic, bago yan, for sure sa iba. Sinama ko talaga yan dahil ayan yung point ko ngayong summary lecture. Ano ba ang ibig sabihin ng holoendemic? Essentially, when every individual in the population is already affected or infected with the disease na in the context, no? So lahat affected na, that's your holoendemic. Next, this is a nice question. And background lang para sa ating mga students, may nagtanong kasi previously, no, sa top-notch team, Doc, naglalabas po ba ang board exam ng pictures and graphs? And I will say, yes. Specifically, nung board exam ko, naglabas sila ng image and graph. No? This is the exact image na linabas nila, kaya na-identify ko na they're using the CDC epidemiology kasi galing yun doon. Okay? Now, ang challenge dito is, alam na natin yung definition ng prevalence and incidence, correct? Simply, ang prevalence is the number of old and new cases. Incidence, the number of new cases. What if we're going to apply that knowledge in a graph? So ito na yon. Please take note. Okay? So what is the prevalence of disease during July in a population of 700 people? So what's our answer here? Let's go back to the definition. Prevalence, number of new and old cases. So the answer here is 8/700. Doc, bakit? Again, we're just going to count all of the cases, old and new, in July. So ito yung mga old cases natin from July, 1, 2, and 3. Tapos yung mga new cases natin, ito, 1, 2, 3, 4, 5. So we have a total of 8 cases. Kaya ayun naging prevalence. Eh kung babaguhin ko yung tanong, same image pa din, same graph pa din, pero itinatanong na incidence. What's your answer? So you just count the new cases in the month of July, which is 1, 2, 3, 4, and 5. So ang answer for incidence is 5/700. So ang pinaka-moral lesson natin dito sa slide na to, know how to interpret graphs and images at baka maglabas ng images. Okay? Doc Ian, if they have questions sa chat box, please guide me kasi I'm currently sharing my screen. Wala akong access.
All right, Doc. I think they're trying to answer your questions.
All right.
Answer sila dito.
All right. So another image here, another interpretation. So for distribution A, you can conclude that. So we are now talking about the normal distribution curve, the bell curve. Other term ng ating normal distribution curve is the Gaussian curve or Gaussian curve. So when you see an image like this, since nasa handout nyo na yung ating skew distribution, try to identify first, ano ba tong image na to? This is negatively skewed or skewed to the left. What is the interpretation of that? If we have a skewed to the left, meaning we have an outlier that is it small or big outlier? Very good. Kapag skewed to the left, you have a small outlier. Remember, in graph interpretation, starting from the left side, ang starting count natin here is 0. And pagpapunta na tayo sa right side, mas tumataas yung ating value. Kaya kapag skewed to the left siya, ang ating outlying values are small. Siyempre, malaki. Now, with that definition, the best answer here is that your mean is less than the median, less than the mode. Let's try to dissect that further. So this is a normally distributed curve. Kaya nga siya tinawag na bell curve kasi you will appreciate here the shape of a bell curve. Kapag normally distributed, tandaan nyo, ang mode is equal to mean, equal to median. That is your normally distributed curve. Now, kapag skewed to the left, ito yung nasa case natin, lagi nyo tatandaan na ang median ay laging nasa gitna. So kapag mababa ang outlying value mo, kung ang outlying value mo is small, ang magiging average mo will be small, correct? Kaya yung mean mo will be less than your median. And then your mode is the most frequently observed data. So that is your mode. Okay, so ang skewed to the right mo, again, also known as your positively skewed, outlying values mo malaki. So ibig sabihin, kung ang outlier mo malaki, what would be the effect to the average or mean? Lalaki din. Kaya ang interpretation mo kapag skewed to the right, your mean is more than your median and more than your mode. So that's how you interpret your distribution curve. Now let's talk about your levels of prevention, which is an example of tertiary prevention. Okay. Sige, para doon sa mga hindi pa kabisado yung meaning. Kapag tertiary prevention po, Doc, ibig sabihin, you are trying to prevent the progression of the disease or trying to prevent the complication that might happen in a certain disease process. So with that definition, the best answer here is occupational therapy after a stroke. Why? Because you are trying to prevent the complication of stroke through giving occupational therapy. Doc, bakit mali yung letter E, hospice care? Guys, ang hospice care or end-of-life palliative care is not part of the level of preventions already. Remember, diniscuss yan ni Dr. De La Rosa, na ang hospice care is the end of the line. You are just trying to give comfort to the terminally ill patient. And we are not trying to prevent any complication na because that's the end of the line. That is your hospice care. Ngayon, ang post-exposure prophylaxis for rabies, ano sa tingin niyo ang level of prevention niyan? Take note, this is not pre-exposure, post-exposure, meaning nakagat ka na ng aso and you are thinking na baka magka-rabies ka. So with that, we are thinking about the latency period. We are in the stage of the subclinical disease. So ang post-exposure prophylaxis for rabies is secondary prevention because we are preventing the possible contraction of rabies. Yung treatment of essential hypertension. Treatment of essential hypertension. Ang best dyan is your secondary level of prevention. Well, some will argue that dapat primary yan, pero for this case, let's go back to the definition na kapag essential hypertension, you already have the disease process. Kasi ang rule natin with the primary is wala muna siya dapat disease, no? Wala pang outcome. Ang nasal steroid is a primary prevention because the word itself, to prevent rebound congestion. Now, best here is primary prevention. Let's move on to the next question. Under what circumstances can primary and tertiary prevention of medical disease most obviously be achieved concurrently in different individuals through the treatment of one patient? Sige, I'll give you time to read. Para doon sa mga hirap, ano daw yung isang action na pwedeng tertiary prevention at the same time, primary na nagagawa. All right, so the answer here is when a patient is treated for active tuberculosis. So the management of your communicable diseases like your tuberculosis offers a unique opportunity for prevention. Why? We all know that your tuberculosis is hyper-endemic here in the Philippines, right? So when a patient with active disease or active, nakakahawa, and when we treat your active tuberculosis and we try to prevent the progression and the impairment of that patient, anong level of prevention yon? Ay, galing, very good. That's your tertiary prevention. But remember, at the same time, when we're trying to treat the patient, we are trying to spread the disease of that patient, diba? Kasi nga hindi na siya nakakahawa. And that is a form of primary prevention. Remember, diba? Sabi nga natin sa mga pasyente natin, for the first 2 weeks, after 2 weeks of your medication ng anti-TB meds, hindi ka na nakakahawa. So remember, treating tuberculosis is both tertiary and primary prevention. Now let's move on to your family principle, types of family. Let's try to identify the family structure given in this scenario. Nami is a widower from East Blue. She has a son named Zorro. After 5 years of being single, she decided to marry Luffy, a divorcee from Ayala, Alabang. He has 3 kids. What's her answer here? Anong family structure to? The Straw Hat family. Ay, hindi. Hindi rin to One Piece family. Sample lang. Very easy lang tong question na to ha. The correct answer is blended. So when we talk about blended, this is just the combination of your step-parents and step-children. So si Nami may anak, si Luffy may anak, nag-asawa sila, edi blended family. Remember your extended family ha. This is extension, depende. Pwedeng unilateral extension, pwedeng maternal or paternal side lang, or bilateral extension. Happy family na. Sinama yung lola kay papa, lolo kay mama. So that's your bilateral family extension. Your single parent family, this is very easy, no? Pwedeng hiwalay ka, like yung mga single mom with 2 kids, single parent yon. Pero tandaan nyo to ha, everybody listen to this kasi ito yung lagi nalilito. Doc, ano pong masasabi nyo sa family structure ng isang nanay na may 2 anak, magkasama sila sa isang bahay, pero hindi naman po hiwalay sa asawa, nag-a-abroad lang po yung tatay sa Saudi. Ano kaya sa tingin nyo yung family structure nun? Yes, that is your single parent family. Kahit nakasal siya, wala silang pinag-aawayan, the fact na malayo yung isa sa mag-asawa, that is already a single parent family. Nuclear, this is your basic, consists of your parents, I mean the mother, the father, and the children. Communal, natanong na rin to previously, this is a grouping of individual formed for specific ideological or societal purpose. Kaya nga 'di ba merong SM family, your Jollibee family, ito rin our top-notch family because we have a one societal purpose right now and that is to pass the board exam, which is malapit na. Okay, let's move on to your occupational hazard. Jollibee is a meat slicer from SNR Alabang. He was rushed to the hospital because of an injury involving his right index finger. Upon examination, the finger was hanging only by the skin. Also, it was reported that he was drunk while at work. Given this scenario, which hazard control protocol will be best to prevent this kind of injury? So go back to your hierarchy of occupational hazard. So the answer here is he should follow the policy of no drinking of alcohol at the workplace. Kasi ito yung pinaka-related doon sa case. And you know na lasing siya pumasok, kailangan niya sumunod sa ating policy. Now, relating that, what is the type of hazard control employed if Jollibee followed the no drinking policy at work? This is very easy. Sige. Yung mga nasa Zoom natin, try nyo sumagot actively para talagang matest yung inyong knowledge. Yung mga nasa portal natin, you try to answer it in actively. Alright? So ano ba yung mga no drinking policy at work? That is your administrative control. Diba? Ano ba yung administrative control? That's how you change the way people work in a certain company. And then this is related to your work practice, control or changes in how the work procedure is done. Ito yung mga policies, supervision, okay? So nagkakaroon na kasi ng trend ngayon na pumapasok na rin yung occupational health no, sa ating board exam. Now let's try to review the hierarchy of risk control measure. And this is standard sa lahat ng industries. So from the bottom of the inverted pyramid, we have here the PPE. And this is the less effective, pataas doon sa inverted pyramid natin, more effective siya. Ang pinaka-effective sa lahat is elimination. You physically remove the hazard. But in reality, mahirap gawin yan, mag-eliminate. no? Kasi lagi namang may hazard sa lahat ng ginagawa natin. Next to that is your substitution. You replace the hazard. Okay? Mahirap din gawin yan. Pero ang most commonly employed control of measure when it comes to occupational medicine is your engineering control, where you isolate the workers from the hazard. Okay? Engineering control also is the installment, no, of facilities in order to protect the worker. And then we have the administrative control, which I discussed earlier, and lastly your PPE, no, protective, personal protective equipment. This is not just applicable to the hospital setting like wearing the gloves, goggles, hairnet, no, sa trabaho din, like in the construction industry, like your boots, okay, and then in the welding company, like yung ating mask. So remember that. Okay, let's go to your type of research study designs. So this is the case. A group of patients with lung cancer is matched to a group of patients without lung cancer. Their smoking habits over the course of their lives is compared. On the basis of this information, researchers compute the rate of lung cancer in patients who smoke versus those who never smoke. This is an example of what? Study. All right, mabilis sumasagot ang ating mga students. Very good. Mukhang master na nila itong mga study designs. Again, kung nanood ka ng aking video lecture under epidemiology, I gave a certain ample amount of time for you to understand this. Ano ba yung starting point ng case natin? Okay, so naggrupo tayo ng mga pasyenteng may lung cancer. Okay, that is your case. Tapos, naggrupo tayo ng mga pasyenteng walang lung cancer. And what do you call that? What nomenclature? That is your control. And then sunundan nyo, ang starting point nito ay outcome, and then you look for the association of your exposure. So best answer here is your case control. Remember, in case control study, diba, usually we are working against the time, no, when it comes to the direction of inquiry. Ang starting point natin is grouping yung mga population with the disease, and that's, we define it cases. And then the population without the disease control. And then we look for the exposure. So, ang starting point neto usually kapag case control, your outcome then to exposure. Ito ang ating clincher question sa mga kababayan. Dapat with feelings. What is the inferential statistics used in case control? Yan, sige. Kahit magmukha kang tanga sa katabi mo, magsalita ka, ilabas mo yan. Very good. It's your odds ratio. Okay, that's your inferential statistics. Nako, high yield yan. Hindi ka nag-prevmed kung hindi mo alam yan. Let's move on to your disability. Heidelin loses vision because of bilateral retinal detachment after an encounter with Nesty. Luckily, there are braille in the elevator, so he has no problem getting around. What is the condition of Heidelin? Is it impairment, disability, impairment and disability, handicap, or yung tatlong components na yan? Meron si Heidelin. Sagot-sagot na. Very good. So if you answered A and B, that is the correct answer. Doc, why? Nako, lagi itong china-challenge yung tanong na to. Well, sa case natin, hindi na mawawala ang impairment ni Heidelin because meron na siyang loss of physiological function ng kanyang eyes. Nagkaroon na nga siya ng bilateral retinal detachment. And going back to the handout, ang definition ng impairment natin is abnormality or loss of physiological function. Now, bakit doc disability din? When we talk about disability, dapat yung mga normal na ginagawa ng whole population, nagagawa ng isang tao. Okay? So since si Heidelin, no, I mean ito, for example, ako, normally, kapag sasakay ako ng elevator, pipindutin ko lang yung switch, okay na ako. Pipiliin ko yung floor, okay na ako. Okay? Pero si Heidelin kasi, okay, since meron kang braille, okay, wait, so si Heidelin, so since meron presence of braille, assisted si Heidelin at nagagawa na yon. But the thing is, hindi iyon yung normal na ginagawa ng normal population. Kaya siya disability. Doc, bakit wala siyang handicap? Kasi yung handicap, ayun yung hindi mo na nagagawa or there's a prevention of the fulfillment of your action. And in this case, ang action lang naman ni Heidelin ay sumakay ng elevator. Nagawa niya pa rin yun, kaya hindi siya handicap. Yes, impaired siya. Yes, may disability siya. Pero hindi siya handicap kasi at the end of the day, nagagawa niya pa rin sumakay ng elevator. Alright? So remember your impairment, disability, and handicap. Ang impairment, organ, anatomical level. Ang disability mo, no, more of the performance. Ang handicap naman, societal ang application.
Doc, sorry. Can I interrupt if there's a question?
Yeah, sure.
Okay, so one of the students asked, hi Doc, clarification for this question. Bakit hindi po yung elimination of the meat grinder based po sa reverse pyramid sabi elimination is the most effective and the question ina-ask po most effective?
Yeah. So ang gusto niya, ang dapat dito ang sagot we are pertaining with this question, right?
I guess so.
Well, kasi ganito yon. Yung explain ko kanina, no guys, it's sinabi ko, 'di ba, sa tunay na buhay, in reality, hindi talaga applicable na alisin natin yung meat slicer. Kasi kung mawawala yung meat slicer, wala nang magagawang trabaho. So, yes, elimination kung kaya, pero in reality, especially in the industry of service, we cannot do that because we cannot perform our task anymore. Okay? So, ayun yung reason doon.
And then another question, Doc. Sorry. Good evening, Doc. Regarding the Jollibee SNR finger injury, wouldn't replacing the machine with an automatic letter D, nalimutan ko na po yung exact wording, be considered an engineering control which is superior to an administrative control? Thank you po.
All right. Okay. I get your point. Kumbaga, if you're referring to the inverted pyramid alone, dapat nga naman engineering control. Pero again, the reason why I constructed this question like this, because you need to be responsive to the question. Kasi sa board exam, kailangan nakakalimutan ng mga estudyante mag-relate sa question. Bakit ba kailangan sumunod siya sa policy? You go back to the cause and effect, the problem tree analysis. What is the root cause? Bakit ba nagkaroon ng naputol yung index finger ni Jollibee? Kasi pumasok siya ng lasing. So we need to be responsive to the question. But I do understand. I agree na engineering control is much higher than your admin control. But go back, be responsive to the question. Go back to the case. Thank you, Doc Ian. Magandang tanong yun. Actually, ayun yung point ko kung ba't ginawa ko yung question na yun. You need to be responsive to the question. So let's move on. So far, na-address naman in real time. Ayan. So let's talk about your bias. Sarah P undergoes a screening test and a tumor was discovered. The screening advanced the time of diagnosis, but no true prolongation of life occurs because there are no effective treatments available. What form of bias is this? Very good, everyone. This is your lead time bias, and this is best explained by this image. So I'll be showing you two graphs here. One at the top, this is your lead time bias. One in the bottom, this is your length bias. Ang lead time bias kasi, guys, in reality, ang screening, problematic din yan, okay? Yung screen ka ng screen, over-screening will just give you harm rather than help when it comes to dealing with certain disease process. So dito kasi, imagine this first line is patient A and then the second line here is patient B. Si patient A, meron siyang capacity to do early screening. Si patient B, wala siyang capacity to do early screening. So si patient A, since nagkaroon siya ng early screening, doon niya nalaman, doon sa screening procedure na yon na may cancer siya. Alright? So yun, meron siyang lead time of knowing that he or she has cancer. But on patient B naman, nalaman niya lang na may cancer siya kasi nandun na siya sa part ng clinical disease, sa history of disease. No? Symptomatic na siya, kaya nalaman niyang cancer siya. Now, comparing the both cases, sino yung parang may mas mahaba ang survival time? pipiliin nyo si patient A. But in reality, this is just a perceived survival time. Nalaman niya lang ng mas maaga na may cancer siya, pero at the end of the day, sabay silang namatay. And that is your lead time bias. Pinaasa ka lang ng screening na akala mo magsusurvive ako, hahaba buhay ko. Pero ang totoo lang, mas maaga mo lang nalaman na ikaw ay may cancer. Versus your length bias, no, marami ring nalilito dito, pero sa case natin sa exam, kapag binigyan kayo ng case ng indolent and aggressive cancer at kung gaano kabilis ang presentation ng symptomatology, doon nyo malalaman na it's a case of length bias. Okay? Ito kasi yung point. If you have an aggressive cancer, hindi naaabot sa point na may screening time ka kasi aggressive nga siya. Ibig sabihin, symptomatic ka na kagad. Malalaman mo na may cancer ka. Versus doon sa may mga indolent cancer or less aggressive cancer, you have time to do screening. Okay? And then, since nalaman mo may screening ka, inisip mo na yung screening na yon yung nagpahaba ng buhay mo. But in reality, kaya lang naman humaba ang buhay mo versus doon kay aggressive cancer kasi yung cancer mo is less aggressive. And that is your length bias. So please don't forget that. Maraming nalilito dito. Okay, let's move on to the scales of measurement of data. The place of birth is an example of what? Measurement scale. Place of birth. Actual board exam question. Yes, very good. Straight recall. This is your nominal type of data. And when we are talking about dichotomous, there are only two possible values. Most commonly, male, female, dead, alive, cured, not cured. Okay, so that is your dichotomous. Your ordinal is intrinsically ordered. Again, order ang ordinal, but not in a quantitative way. Meaning, if there's a count, that is not a real count. Okay, ang example ng order nyo, good, better, best, always, sometimes, never. Ang interval nyo, there's a real numerical units, but your zero there has a arbitrary definition. Walang clear 0 point. For example, best example ko dito, temperature. Pag sinabi nating temperature, may real numerical unit siya. Okay, 0, tama. Pero yung temperature kasi natin, may mga different metric measurement. Pag ba sinabi kong 0 degree Celsius, magiging 0 Fahrenheit siya or 0 Kelvin? Hindi, di ba? Kaya siya interval. Ibig sabihin, tandaan mo to, ang 0 point mo is arbitrary. There's no clear 0 point. But when we talk about ratio, measurements in relation to the 0 is clear. 0 is not arbitrary. Meaning, kapag ako ay 0, sabihin na natin, kapag 0 ako, alam mo na yung 0 na yon is clear. Okay? So, for example, 0 meter. Alam mo na 0 sa centimeters yon. Alam mo na 0 sa millimeters yon. So, there's a clear point 0. Very good. So the blood type is what kind of measurement scale? This time we're going to mix and match. Kasi tinatanong to, 2 steps recall. Very good. Okay, it's your qualitative nominal. So remember, ang moral lesson natin sa slide na to, you know how to categorize your data kung siya ay quantitative or qualitative. So hindi ka doon titigil. Dapat alam mo i-categorize kung yung quantitative mo ay interval or ratio at alam mo i-categorize ang qualitative mo if it's nominal, categorical. Alright? Tinatanong yan. Next question tayo. Which of the following is a sensitive indicator of the standard of healthcare by analyzing the number of deaths over 50 years old? We are now talking about vital statistics. What's our answer here? Mabilis. Nako, very good. Favorite nila to. Na-emphasize ko to sa lecture. It's Swarups Index. Okay? So this is part of your vital statistics. And later on, we'll discuss yung mga iba. Yung child mortality rate, maternal mortality rate, and dependency ratio. Again, kanina sa clarification, yung dependency ratio, it's a formula. You follow the formula, which is 15 to 64. Okay? Pero this time, it's Swarups Index. So what is the numerator? number for your swarups. It's the number of deaths among those 50 years and older in a calendar year. What is the denominator? Total deaths in a year. Remember the factor or the K, 100. Okay? O next tayo. Definition naman ito ng precision and accuracy. In a study of a novel antihypertensive drug, the experimental group had a mean systolic blood pressure of 123, 125, 124 respectively on a 3 separate measurement. The mean now was 124. Which of the following statements below best describe the situation? So this time, application lang ng knowledge nyo in accuracy and precision. Very good. The answer here is the measurements are precise and accurate. Going back to our definition, when we talk about precision, it's how close the measurement of the same item. Malamang, same measurement ng BP and how close yung mga measurement na yon to each other. That is your precision. Magkakadikit naman, di ba? 123, 125, 124. Actually, kapag ginawa mo yan sa bullseye, magkakadikit sila. Now, ang accuracy naman is the closeness of each measurement or the computed value to its true value. Meaning, yung iyong mean, itong mga individual measurement nyo, they are close to the true value or mean. Kaya yung statement na ito ay precise and accurate. Let's go to the walang kamatayang formula for sensitivity. And this is a previous board exam question. Tinatanong lang nila simply, what is the formula of sensitivity? And ito lang yon, yung mga choices na yon. So dapat by heart, alam mo na. Pero ako, minsan, ang trick ko dyan, para hindi ako malitot, wala akong active memorization, dinodrawing ko na yan or sinusulat ko na yan sa ating mahiwagang 2x2 table. Okay? So this is just simply a simple recall question. This is your true positive over the sum of true positive plus false negative. Now, para sa mga first-timer, mga ngayon pa lang nakita ang ating 2x2 table, okay? At kumakapit lang sa summary lecture, nako, mag-video lecture at handout kayo. Pero this is your 2x2 table. In your 2x2 table, okay, remember on the left side, usually dito natin dinalagay yung ating exposure or yung ating screening. And on the top side naman, dito yung ating disease status. Starting muna doon sa positive or with the disease or with the outcome. And then doon sa second naman, yung walang outcome or yung walang disease. Okay? So itututok nyo lang yan. Positive, positive. Diba? That is your true positive. In some cases, ang ginagamit sa exam, instead of your TP, ang ginagamit is the cell letter, which is your A. So pwedeng ang maging permutation nito ng sensitivity formula nyo is A over the sum of A plus C. But it's just the same. Binigyan lang ng definition yung true positive, false negative, etc. Now, that's the form, that's how you follow your 2x2 table. False positive meaning you are positive in the screening, but in reality, you don't have the disease. And by the way, guys, tinanong na rin yung individual definition ng true positive, false positive. Kaya sa handout nyo, nasa yellow box yan. Pero this time, makinig na muna sa akin para ma-master nyo na ang konseptong ito. Kapag ikaw ay negative sa screening at wala ka naman at ikaw ay may sakit talaga or you have the outcome, you are false negative. And if you don't have the outcome or the disease and you are negative, true negative talaga yon. And how do we approach this 2x2 table? Ayun lang ba yung matutulong sa'yo? Hindi. Paano kung narin nakalimutan mo yung formula? You just follow yung ating horizontal analysis and vertical analysis. Look, your sensitivity is from your vertical analysis. Okay? So tignan nyo, follow the arrow pababa. So it's your true positive over true positive plus Fn. Ang inyong specificity naman, vertical pa din pero pataas. Your true negative over the sum of true negative plus false positive. Bakit tinawag kong vertical analysis, horizontal analysis, yung positive predictive value and negative predictive value? Kasi nga, itong line na to, yung axis na to, yung sinusundan natin. So positive predictive value is TP over TP plus FP, and then yung inyong NPV ay pabalik. Your TN over the sum of TN plus FN. So again, ang tip ko sa inyo kapag nasa 12 subject na kayo, last day of the board exam, pag binigay na yung inyong test paper, isulat nyo na kagad yung 2x2 table plus the formula para nagre-refer na lang kayo. Okay? Pwede naman kasing sulatan ng ang ating questioning. Next question, let's talk about sampling. High yield sa board exam ang non-probability sampling at probability sampling. Kaya this time, dapat alam mo kung ano yung non-probability sa probability. So what sampling method is employed when households are selected at random and every person in each household is included in the sample? This is the common case of your cluster sampling. Ibig sabihin, kapag cluster sampling guys, gumawa ka ng clusters mo. At kung ano man yung kusino man yung nandoon na element sa loob ng cluster nyo, included na sila sa participants. Okay? So when we talk about elements, ito yung mga individual participants in a study. Okay? Ano naman yung difference niya sa stratified? Parehas may grupo. Ginrupo mo, ginrupo mo. Sa cluster, ginrupo mo, pero kasama yung buong grupo. Itong stratified, naggrupo ka, pero kada grupo, isa lang ang kukunin mo. That is your stratified sampling. Ang systematic sampling, from the word sistema, may sistema ka because you usually start at random and then you will compute for the interval and look for the factor. Ang simple random sampling, guys, ang other term niyan ay your fishbowl method. Simple lang. Okay? Pero dito sa SRS nyo, lahat ay may equal chance of mabunot. Okay? Kaya nga dito, sa simple random sampling, pag nag-fishbowl method kayo, pag nabunot mo na yon, usually binabalik ulit yon para lahat may equal chance pa rin. Kaya kung mabunot mo siya, ibalik mo pa din, included siya sa participants, hanggang sa bumunot ka ng bumunot, makompleto mo kung ilan yung gusto mong participants. Pero at this slide, kaya ko to linagay dito kasi nga, I want to have an emphasis on the difference of your cluster sampling and your stratified sampling. So again, going back to the definition, the population is first divided into sampling units. Ang tawag mo doon, clusters. Okay? And then, there will be a sample of clusters that will be selected. And every element found in each cluster is included in the study, okay, versus your stratified na in every sample of strata, one participant per element only. Now let's go to your different types of your graph. Okay, so which graph is suitable to be used to show the increasing cases of dengue from 2009 to 2023? Previous case din ito sa exam. Binigyan ka ng time element. Kapag may nakita kang time element and there is a temporal relationship at yung may increasing and decreasing cases, ang best answer is everyone answer. O yung iba hindi sumasagot, naghihintay na lang ng tamang sagot. Sumagot kayo guys, sayang yung opportunity. Active learning tayo. Very good. Your line graph. Okay? Frequency polygon is just a comparison of two lines. Your pie chart, diba? That's a proportion. And usually the total percentage of a pie chart is 100%. No? Dapat matandaan nyo rin yung pie chart, yung rules on how to develop a pie chart. Okay, for example, yung kanyang clockwise presentation, usually dapat ang ating number of variables here, iba-iba to sa literature, do not quote me on this ha, hindi to strict. Yung iba ang gusto less than 5 categories or variables, yung iba hanggang 7, 9. Okay, pero importante, when you are trying to use a pie chart, konti lang yung number of variables or categories nyo. Okay? Next question, laging tinatanong, most common measure of central tendency, yung iba kasi nakakalimutan. This is your mean. This is the most common measure of your central tendency. Pero paano do, kunwari tinanong, common measure of central tendency, walang mean, ang nandoon average. Average po ba isasagot ko? Malamang, no, kasi nga, we can use that interchangeably, mean and average. Let's go to your type of statistics. What statistical tests should be used in comparing the serum cholesterol levels of patients before and after intake of a new lipid-lowering drug agent? This is very easy. Ang ating keyword here, keywords is your before and after, but you only have one intervention. And this is your paired t-test. Your unbiased analysis of variance, usually you're having more than two population group. Chi-square is just the comparison of two categorical variable. And then usually itong mga example na pinakita ko sa inyo, these are parametric tests. When we say parametric tests, assuming that it is targeted to the whole population. Non-parametric, usually small ang number of population yan. Okay? So this is your table of your commonly used statistical tests. I know it's quite intimidating, but I just want you to focus more on the parametric tests kasi ayan yung applicable sa healthcare researches. Okay, kasi nga naman kapag gumamit ka ng population na malaki, it is parametric. Let's go to the part of vital statistics. Recall, laging lumalabas, what is the most sensitive index in assessing health status of the community? Nako, recall. Yung mga hindi nakasagot nito, kabahang ka, aralin mo to, importante to. Alright, so the correct answer here is your infant mortality rate. Tandaan nyo yan. No? That is the most sensitive index in assessing health status. Why? Because your infant is the most vulnerable group when it comes to your vital statistics. And syempre, kung meron kang poor health status, sila yung pinaka-magsasuffer. Now, let's try to compute everybody. I won't read the question. I'll let you read the question. I'll give you a minute to answer this. I-practice lang natin. Ilabas nyo na yung mga calculator nyo. By this time, dapat meron na kayong allowed calculator na pinescribe ng TRC para napapractice nyo na yan. Ha? Dapat yung mga calculator nyo praktisado rin, hindi yung bago. Tip ko din sa inyo, may nangyari na before. Bumili ng bagong calculator. Dinala sa board exam. Pagkabukas, walang battery be. Ano na? I-check nyo. Sige. Story time ako habang nag-a-answer kayo ha. Walang battery ang calculator. Meron namang nagdala calculator. Yung calculator ng palengke, yung malaki. So kada compute niya may tunog. Tut, tut, tut. Nakautang na loob. Magdala kayo ng walang tunog para hindi kayo makaistorbo. Okay? At saka baka kabahan yung iba, ba't gumagamit ka ng calculator na may tunog? Eh wala namang computation. Totoo. Ayan. Sige, this is just a sample computation based from maternal mortality rate. So hopefully meron na kayong answer. Sige, I'll be checking the participants here. Heart react muna yung mga nakapag-compute na. Yung mga nakapag-heart react, automatic pasa na kayo sa board exam. O, di ba? Ang bilis. Ayan tayo sa mga nagre-review sa board exam, very superstitious. O, tignan mo, tumataas ang aking heart reacts. Ayan. Sige, congrats. Pasa ka na sa boards. So what's the answer here? This is your maternal mortality rate, specifically your sepsis, and the formula is maternal mortality due to sepsis. And based from our case, there are 30 cases of sepsis. What's the denominator for this case? It's the maternal mortality due to all causes. Now, based from our case, we have 30 sepsis, death, and then we have total of 200 mortality of mothers, maternal mortality. So simple math, use your calculator, 30 over 200, you will get 15%. So if you answered B here, congratulations. Practice lang ng practice. Let's talk about the concept of prevalence. Kanina, yung application natin ng prevalence is through graph. Ngayon naman, ang application natin ng prevalence is through wordings. All of the following increases prevalence rate except sumagot ka. Ayan. Oh, wow, may heart pa din talaga. Ayan. Kada heart plus 1 sa PrevMed. Oh, ayan. Ako talaga naman superstitious. I-bless natin kayo. Ayan. Virtual blessing. So here, except high case fatality rate, no? Talaga namang inexplain ko 'to ng mabuti sa aking video lecture. When you have a longer duration of illness, mas matagal ang chance mo na mabilang ka sa isang prevalence survey, correct? Kaya the longer the illness, the higher the chance na ikaw ay masasama pa sa survey. Second, if there are increasing number of new cases or there is new incidences of a certain disease, then tataas talaga ang prevalence. Kapag maganda ang case finding, improve ang diagnostic facilities, nakakapag-diagnose ka ng mga diseases, tataas ang prevalence rate. Never tataas ang prevalence rate kung namamatay na ang mga cases, correct? Kasi nga, pag nag-survey ka, hindi mo na sila mabibilang or hindi na sila included sa count. So here, the correct answer is high case fatality rate. Now let's move on to the basic epidemiologic framework. Epidemiological concept stating that the effects never depend on a single isolated cause, but rather each link is the result of a complex genealogy and antecedents. Nako, in-explain ko to ng mabuti. Recall lang to. At kapag ang sinagot mo ay web position, tama ka do, congratulations. Pero kailangan nating reviewin ang epidemiological triad. Everybody say, ano ba ang ating elements or component of your triad in epidemiology? It is what is our mnemonic here? It's our HEA. HEA, it's your host, environment, and your agent. Now, your lever or balance also deals with the elements or triad. But this time, ano yung fulcrum? Ano yung fulcrum sa lever or balance? Very good. It's your environment. And if there will be a disequilibrium in that seesaw because of the fulcrum, tumaas si host, bumaba si agent, there will be a disease. And then we have the will. The wheel is somehow similar to the other concept, pero ang wheel nyo meron siyang different environment. And in the middle, you have the core, the host. Diba? You have the outer environment that you need to remember. Ano yung three subcomponents na yon? Na environmental component, okay, then we have here your social component, and then your biological component. So balikan ng handout kung nalilito pa. Next question refers to the constant presence of a very high incidence of disease infection. Previous board exam question. Very high. Persistent. That is your hyperendemic. So do not be confused with endemic. Okay? So ang clarifier, ang qualifying word natin dan, if the number of cases or the frequency is persistent or very high based from the baseline. Let's go to the study design.
Doc, we have questions lang, sorry.
Yes.
Good evening, Doc. Maki-ask lang kay Dr. Man regarding sa sample question po about levels of prevention. Pa-clarify lang po ulit, bakit both primary and tertiary prevention po ang treatment of active TB? And is it not also a secondary level po? And may rationale po ba why other choices were not correct? Thank you po, Doc.
Alright. Hopefully, nakinig ka kanina and then we will just clarify it. Based on the choices kasi, ang available lang doon is primary. Ang tinatanong lang naman natin is primary and tertiary. Pero bakit dinagpasan natin, Doc? Bakit hindi kasama yung secondary level prevention? Again, remember, kapag ginamot natin ang isang active tuberculosis patient, meaning siya ay nakakahawa. Sa konteksto ng index patient o ng pasyente, kapag ginamot mo siya, okay, hindi mo na mape-prevent natin yung progression ng tuberculosis. That is tertiary, di ba? Kasi ang definition natin, progression of complication. Hindi naman rehab ang ginawa natin. Ginamot natin, binigyan natin ng anti-TB meds. So gumaling. So hindi na nag-progress, hindi na nag-complicate. Tertiary. Bakit siya primary? Ang primary kasi, in the context of the whole community or population, wala pang sakit, okay, yung community. Bakit siya primary? Kasi nga, pinigilan mo na siya ay makahawa ng ibang pasyente or nung taong nakapaligid sa kanya. Now, why not secondary? Secondary kasi is more of screening. Ang naging intervention lang natin is treatment. Okay? So ang best answer pa din talaga is primary and tertiary. And I do appreciate your question, Doc, kasi marami talagang nalilito doon. Pero I want you to appreciate that you need to be responsive with the case, na kaya siya tertiary and primary lang, kasi ayun lang yung applicable doon sa context ni pasyente. Wala tayong ginawang screening, and hindi naman natin kailangan mag-screening sa mga pasyente na clinical na. Kasi it doesn't make sense. Why would you screen someone na you know na positive dun sa disease? Hopefully, maintindihan natin yon.
Doc, meron pa tayong isang question. Pa-clarify po, Doc, yung question na may sagot na cluster. Hindi po ba stratified yon? Thanks po. Pa-enlighten and pa-clear na lang po, Doc. Thank you po.
Alright, so I'll repeat it again. This time, I'll try to annotate, okay? Para maintindihan natin. Where is the draw here? Okay. So ang cluster sampling kasi is gumawa ka ng different groups of groups. For example, ang ginamit doon, different household daw. Ayan daw yung ginawa nila. Okay? So sabihin natin, guys, tayo ay researcher sa isang barangay. Okay? Doon sa isang barangay na yon, madaming bahay. Ayan, triangle na lang ha, kasi bumabagal ako. So nagkaroon tayo ng random selection of the household. And alam naman natin, guys, di ba, sa household may nakatira. Depende kung ilan, nanay, tatay, kapatid, kuya, lola. Okay, so sa cluster sampling, kinonsider mo yung isang bahay as a cluster. At sa cluster sampling, kapag randomly nakapag-select ka na ng household, which is a cluster, lahat ng nakatira doon or the elements inside of that household is already included in your participants. Versus sa stratified, okay, sabihin na natin, itong mga household, ginawa natin silang strata, grupo pa din. Grupo. Pero randomly na-select mo tong bahay na to. Dito, sa strata na to, isa lang ang pipiliin mo at hindi lahat. So ang difference doon is the inclusion of the elements. Cluster, sa isang household, lahat. Pag strata, sa isang household, isa lang, stratified. Okay? Sige. Clear tayo doon ha. Okay lang yan. Thank you for that question. Hopefully yung iba natuto with that question. Okay, let's try to answer this. Let's move on. Study design that assigns, manipulates a patient's environment is what type of study design? Okay, heart react para sa mga tapos na. Nakikinig pa ba tayo dyan, mga ka-heart react? Ayan, ang mga maka-heart react ngayon, makaka 200 plus sa midterms. The correct answer here is, yan, di na siya gumana. Bakit? Ayan, clinical trial. The fact na there's a manipulation, this is already a trial. Okay, remember that your cohort, there's no manipulation of patient. Simply, we are just observing them. Okay, actually sa cohort, di ba, we start with the exposure and then we follow until they develop a outcome. Alam din natin ang cohort, two types yan, retrospective and prospective. Ang cross-sectional mo, we don't manipulate patient again. We only assign them. Assign them whether they have the disease. And when they have the disease, they are called the cases. When they don't have the disease, they are called control. Okay, cross-sectional, the other term here is your prevalence survey. Depende kung analytical study, kung descriptive survey. Ano ang best keyword natin or buzzword natin sa cross-sectional or prevalence? It is a snapshot of time. Next question tayo. A study enrolled 355 participants in a dedicated weight loss clinic and tracked their health annually. Track health annually for an average of 4 years to see whether there is an effect in reduction in atrial fibrillation burden and severity. What is the study design? Oh, hanapin ang keyword. Yung ating mga portal students, please pay attention. Okay. So kung ang sinagot mo dito ay cohort, very good. Kasi nga naman yung keyword natin ay nag-track, sinundan for 4 years. Okay. And just to check your knowledge, anong type of ano to? cohort kung susundan. It's your prospective type of cohort. Very good. Now, your meta-analysis, para lang ma-share ko sa inyo, tinatanong din yan sometimes, okay, that is your most powerful. No, when we go to the EBM or evidence-based medicine pyramid, it is on top of the pyramid. Meta-analysis, higher ang kanyang power, lesser ang kanyang bias. Now, this is just a difference showing you the study design or methodology of your cohort and case control. Paulit-ulit tayo. Kapag ang case mo, ang starting point lagi ay exposure, tapos susundan over time or binalikan at nagkaroon ng development ng outcome, that is your cohort. At ang iyong case control, kapag ang starting point niya lagi is the outcome, at sinundan, relate, inassociate kung ano yung mga exposure na nag-cause but nagkaroon siya ng outcome, that is your case control. And tandaan mo ngayon, uulitin ko ang aking mnemonic, kapag inferential statistic of cohort study, it's your, what's the inferential statistic? Everybody say, very good, relative risk, okay? And then when you say case control, what's the inferential statistic? It's your odds ratio. Alright? Sige. Very good tayo dyan. Ngayon, pag-usapan naman natin ang cycle of behavioral changes. Changes of behavior. In counseling a patient in smoking cessation, the patient answers, I don't think smoking half a pack a day can do so much harm. After all, I'm already 75 and I've done it for the past 25 years. Which among the following is the patient currently in terms of capacity for change in behavior? Ito naging naging favorite na rin to, not just in the board exam but also in family medicine residency. So what do you think is the answer here? For sure, yung iba dyan nalito, sinagot contemplation. But the best answer is pre-contemplation. Go back to your handout or listen to me. When we say pre-contemplation, they're not even thinking about changing anything from their behavior. There's an active sign of resistance. Okay? Ngayon guys, ang challenging kapag family principles ang tanong, kailangan bumalik ka doon sa stem, sa kaso. Okay? Aralin mo, basahin mo, read in between the lines pa nga eh. Basta itry mo i-visualize yung case para hindi ka manilitaw. So this is the ating cycle of behavioral changes. Again, pre-contemplation, the patient usually has no intention in changing his or her behavior. And then sa contemplation, ang magbabago lang dito is aware na siya that there is a problem, pero wala siyang planong gawin yon. Actually, yung mga doctors usually stuck at contemplation because we all know, no? For example, yung mga ibang naninigarilyo dyan, aware naman akong problema siya pero hindi ko kaya. Yung mga lasinggera dyan, aware naman ako pero hindi ko kaya. Okay, and then you have the preparation, you now have the intention of taking the action to address the problem. And then when you do something for that problem, then that's the action already. Now, when you reach something and you will try to maintain the change of behavior, that is what you call the maintenance. And then relapse, balik ka sa dati mong behavior. But remember, this is the clincher. Every time na ikaw ay nag-relapse, do not consider that as a failure. Actually, you learn something from that relapse. And the next time na ikaw ay dadaan sa cycle, you will not encounter that same problem that you had before. Okay? So that's the cycle. Let's move on to the family life cycle. A family consists of the mother, the father with 3 children. The eldest is a medical student, age 22. The middle child is age 17, taking up an undergraduate degree while the youngest sibling is 9 in primary school. Ano ang stage ng pamilya na to? Common mistakes of the students here. They're trying to make the case na buhay nila. They're imagining na sila yan. Hindi porket ikaw ay may nabasang medical student, pipiliin mo na yung case dito according to your life cycle. No. Okay? You choose according sa case. And for sure, yung iba sa inyo, sasagutin is launching family. But for this case, it's family with adolescents. Kasi yung medical student na yan, hindi pa siya nalo-launch. It's not part of the description. Now, if you're having difficulty here, I'll leave you time. No, later, balikan nyo yung life cycle. Pero bigyan nyo siya ng oras because it's really important. Okay, impact of illness naman tayo. Patient was discharged from hospitalization after having a stroke, which left him with residual left-sided weakness. He is regularly being seen by his physician for follow-up. Compliant sa gamot. Nag-a-attend ng regular physical therapy. What stage is he in the family illness trajectory? Very good. It's your early adjustment to outcome. Yung iba, no, sa impact, nalilito sila sa onset of illness to diagnosis tsaka impact phase. Kapag doon sa case, nagsimula na doon sa diagnosis, na-diagnose na, wag na kayo sumagot ng onset of illness to diagnosis. Doon na kayo sa impact phase. Kunwari, a patient consulted a physician and the physician reported that the patient have stage 4 cancer. Has stage 4 cancer. Hindi na yun onset of illness to diagnosis. That is already impact phase. Kasi an onset of illness prior to having a consult to a doctor. Ha? Sakit ko rin yan dati. Lagi ako nalilito. So huwag kayong malilito dyan sa impact of illness. So again, these are the different stages ng impact natin. We have the onset of illness, then impact phase, okay, and then major therapeutic efforts. Ito, kaya ito nakabold kasi ito yung laging tinatanong. This is the most challenging and rewarding stage, not for the patient, but for the physician. Okay, and then early adjustment to outcome, and then lastly, adjustment to the permanency of the outcome. Let's talk about your genogram. Very easy, baka lang malito. The following are true about constructing a genogram except your index patient marked with a triangle. This is wrong. Why? Why? Sagot sa sarili. Hindi ka pa rin sumasagot. Sumagot ka. Ayan. Index patient marked dapat with an arrow and not a triangle. Arrow dapat yan. Now, when you construct a genogram, it's important you have 3 generations, starting from the grandparents, the parents, and the offsprings. Ang firstborn mo should be farthest from the left. Again, pinaka-left. The way I interpret this, yung firstborn sa pinaka-left siya. Okay? Hindi yan farthest sa left na nasa right na siya. Nasa left yan. And then, syempre, kailangan lagyan mo ng family name above each main family. And then, usually, dinalagay din sa genogram yung date kung kailan siya ginawa para every time na sine-check mo yung genogram na yon, nalalaman mo kung ilang taon na yung mga patient, yung family members and the index patient. Okay? Let's talk about your family assessment tools. Nako, hate na hate ko to kasi litong-lito ako. Pero hopefully, makuha nyo sila. Family assessment tools used to assess the capacity to participate in provision of healthcare, cope with crisis. Provision of healthcare. Kaya ba nilang mag-provide sa family member nila may sakit, especially when there's a crisis? Ngayon, kung crisis lang yung naging point of recall mo, mali yan, ha? Kailangan tandaan mo na ang screen natin, not just with the crisis, hindi, kasi ang mnemonic ko dito dati, mnemonic, ano ba? When there's a crisis, what will you do? You scream. Pero, it's more of the provision of healthcare. So let's have a review. Baka naman puro kayo scream, pero hindi nyo alam kung ano yung inclusion ng acronym ng SCREEM. Everybody ready? O, pay attention na muna. Let's try to identify yung acronym ng SCREAM. Beginning with letter S. This is very good. Social. How about C? Okay, cultural. Next, R. Okay, religious. And then E, we have economic. E, another E, educational. And lastly, M, medical. Okay? Again, ang family genogram natin, it's a graphic representation. Kapag ginamit yung family tree, nako, genogram na yan. Nag-display din siya ng relationship among individuals. And then your APGAR, it's a 5-item questionnaire. Okay? Usually, we measure the satisfaction with family relationship. Ano yung APGAR na yan? Hindi yan yung APGAR ng baby ha. Family APGAR yan. Hindi yan appearance. Okay? Hindi yan pulse. Hindi yan grimace. Your A is your adaptation. P for partnership. G for growth. Okay? Then affect. Then R for resolve. Your Minition family map. Okay, this is your Minition family map shows the family dynamics, okay, of the family members inside of it. Doon sa dinrowing nyo sa circle. Next tool. Measures one level of satisfaction with family relationship usually needed when family will be directly involved in caring for the patient. The correct answer here is, na-explain ko na kanina, your family APGAR. Sige nga guys, what is the maximum score that you can give in APGAR? Sige, chat nyo nga. Ayan, very good. Minimum na pwede nyo ibigay na score sa APGAR. O sige, sa GCS, Glasgow Coma Scoring, ano ang maximum na pwede nyo ibigay? Okay, very good. Sige, 3 ang minimum sa GCS. Alright. Sige, next, which of the following is not included in the expanded newborn screening? Ano ang hindi kasama? Nako, ang daming sumasagot ng cystic fibrosis. Naka-red na nga yung expanded. Expanded to, hindi lang to yung basic na expanded, ibig sabihin lahat-lahat na. The correct answer here is not included ang hypothyroidism. Why? Why? Bakit hindi kasamang hypothyroidism? Kasi you need to qualify it. It should be... Bakit lumipad? Wait. It should be congenital hypothyroidism. Very good. Okay, so we have here phenylketonuria, congenital hypothyroidism, then your adrenal hyper or hypoplasia. Is it hyper or hypoplasia? Okay, hypo. And then we have your G6PD. And then you have your, what's the last one? Hindi ko nabanggit. Okay. Now here, ang previously na tinanong din, ano daw yung recently in-include sa newborn screening nung 2012. Nako, previous boards yan. So kung yan, nako, lahat very good. Na parang nanood ng video. It's your maple syrup urine disease or MSUD. Okay? Tapos tinanong din, what's the Republic Act as the newborn screening? Sagot, type nyo, sabihin nyo, what's the Republic Act? 9288. Okay. Sige, happy na ako sa newborn screening.
Oh, sorry. We have a question here. Male is dapat daw po nasa left sa genogram. Eldest is also sa leftmost. Paano po if the eldest is a female?
Ay, no. It doesn't matter kung sino yung pinakapanganay. Kung
Okay.
babae man yan o lalaki, siya yung pinaka nasa left. Nagkakaroon lang ng problem kasi kung yung panganay mo, babae, tapos may asawang lalaki. So, mangyayari, ililink mo siya, yung male sa left. Okay? Male yung positioning nung square. Pero kapag siblings, order of siblings, kasi hodang babae, lalaki yan, kung sino yung panganay, siya yung pinaka-left or babae man siya. Okay?
Okay. Next question, Doc. Good evening. Can I ask po, Doc Louis Man, the difference of stage 4 early adjustment from adjustment for permanency stage 5 in relation po to the case previously? Thank you po, Doc.
Alright. When we talk about adjustment, if syempre ano to, contextualize sa case. Pag for example, no, nasa last part na siya ng illness, I mean permanent na talaga, okay, pilay na siya forever, that is already permanent. Kapag early adjustment, ayun yung early diagnosis mo ng cases na alam mo ring na debilitating. Okay? So, lagi lang, alam ko there's a fine line, okay? Pero kapag inintindi mo na nandun na siya sa talagang permanent, wala ka nang magagawa. For example, lumpo, naputol ang paa, nabulag, okay, na stroke, bedridden, permanent na yon. Pag early adjustment, more of the initial diagnosis of a case that you know that will be debilitating. Okay? Oh, and then, ayan, si Doc MM, meron din siya doon, usually stage 4 is post-hospitalization after major therapy. Ayun. Thank you, Doc MM. Ayan, nag-monitor na ako ng chat. Sorry, ito, this presents fundamental strategies and approaches for health promotion. Si Doc Abraham, okay, Ottawa Charter. Okay, with the participants considered vital for major progress. Sorry, this is just a simple recall. Kapag di mo alam, hindi mo alam. Kaya ang moral lesson, kahit dinaanan mo lang sa handout, go ahead, daanan mo lang. Basta mabasa mo, malaman mo na may Ottawa Charter. Your Alma Ata Declaration, that is anchored to your primary health care. Okay, let's talk about health promotion strategies. Formation of neighborhood walking clubs to combat hypertension and high cholesterol is what form of health promotion strategy? Another concept na kapag hindi mo alam, di mo alam. The correct answer here is social. Okay? Kasi nga naman, you have a neighborhood walking clubs. Pag educational, more of you teach educational programs, organizational, you're organizing, for example, annual hearing and vision screening in schools, legislative, just go straightforward. Okay? Yung mga policies, laws, social, yung mga formation of groups, economic, one that is related to businesses that offers protection, health promotion strategies. Regulation aimed at reducing youth access to tobacco products and alcohol is what kind of health promotion strategy? Nako, nasabi ko na kanina. It's your legislative health promotion strategy. Very good. Mabilis kayo sumagot siya. Konti na lang guys. Matatapos na tayo. Na-cover na natin lahat ng pinaka-importanting konsepto. Eto, paulit po. Ang bilis naman, wala pa ang question, may sagot na. Everybody, gayahin ako, ability of an agent to produce serious illness measured in terms of fatality is your virulence. Very good. Now, which of the following intervention is the most effective in prevention and control of injuries, especially in the workplace? O, ito na. Guys, bigyan ko na kayo ng chance. Wala na po siyang case. So, ibig sabihin kung ano na po yung pinaka-effective. Ito na po yung pinaka-effective. This is your, wag mo ako sasabihin ng elimination dito. Nako ha, doc elimination po. Again, be responsive to the question. Wala sa choices yon. Your engineering control. Now, going back kanina doon kay Jollibee, si Jollibee kasi may case. So, respond to the case. Pero pag walang case, you answer na kung ano yung pinaka-highest. Recall, which among the following is true regarding UN Sustainable Development Goals? Is it 15 goals, 17 goals, 13 goals? Very good. Your SDGs are your 17 goals to be achieved over the next 15 years. And actually, malapit na siya, 2030. Ilan ang MDGs nyo? Ilan ang Millennium Development Goals? Very good. It's your 8. 126 yung MDGs, may nakakatakot na yon. Ang dami. Okay, now we are talking about Millennium Development Goal. Ano dito yung hindi nag-involve ng maternal health care? Kasi lahat kayo for sure ang alam nyo, maternal health care lang. Pero ano yung hindi involve ang maternal health care? It's your 7. And what is 7? 7 is ensure environmental sustainability. Yung 1, of course, poverty and hunger related to maternal health care also. Okay, gender equality, empower women. And syempre yung number 5, improve maternal health. We are nearing the end of our summary lecture. Congratulations, konting tiis na lang. All of the following are part of the Millennium Development Goals except. Very good. Mabilis kayo lahat sumagot. This is a recall, universal health care. Meron akong additional question. What is the Republic Act for your UHC law? Everybody say 1, 1, 2, 2, 3. Very good. That's your RA 11223. Which among the following vaccine is not part of the EPI program of the Department of Health? And ngayon ay National Immunization Program or NIP. Ano ang hindi kasama sa NIP or EPI? Very good. It's your hepatitis A. Kasi nga naman ang hepatitis A, di mo na kailangan ng bakuna, kumain ka lang sa labas. O, joke lang yun ha. Baka maniwala, maging patola. Okay, hindi. Joke lang yun. Pero ang hepatitis A, it's not included in your NIP, but it is recommended. Okay, that's part of the vaccination strategy, but not included in your NIP. Okay, your Hib, varicella, mumps, and BCG is included. Now let's talk about the immunization. Definition of a fully immunized child before 1 year old, before 1, again, before 1 or before 12 months must be given except, very good, your MMR. Kasi yung iba, hindi marunong mag-comprehend. Bakit? Guys, eto na, story time na naman tayo bago ako magpaalam. The Preventive Medicine and Public Health is the 12th subject of the board exam. This is done on the 4th day of the exam. And I swear you, pangako, pag 4 na subject, ay pag last na subject mo na, pang 4 na araw mo na pagod ka na. Nung first day, ang dami mong kaba, ang dami mong takot. Takot kang mag-shade, takot kang sumagot, takot kang magkamali. Pag dumating yung pang-4 na araw, mawawala na lahat ng takot mo, especially pag hapon na, pregnant na, kasi ang nangingibabaw na lang sa'yo pagod. Okay? So please, wag kang magpapatalo doon sa mentality na yon. You take your last exam seriously. Wag ka sumagot ng 1 beses mo lang binasa at di mo naiintindihan. Tutukan mo pa din, lagyan mo pa din ng sipag. Kaya dapat ngayon pa lang may mindset ka na pagdating ng 4th day, it's like my first day. Ganun ako kaseryoso, ganun ako katutok. Okay? So here again, your MMR. O sige, bilang chikahan na tayo, ano ba ang measles? Kailan binibigay yan? Everybody type or answer. Okay. Ang kaso, sinabi may epidemic, may outbreak. Very good. Mabilis ang usapan natin. When there's an outbreak, you can give your measles as early as 6 months. Let's try to test your comprehension this time. Pagalingan magbasa kasi pagod ka na, pang last question mo na. The following are signs of dengue with warning signs except your thrombocytosis. Why? It should be thrombocytopenia. And based on the warning signs of dengue, okay, may budget tayo, may ano tayo, may pa-highlight at may ayan, malaki ba? Nakikita nyo ba yung lumaki? Yeah, may budget tayo, lumalaki. Ayan, so warning signs, abdominal pain or tenderness. Guys, marami nalilito dito ha. Persistent vomiting. Persistent. Vomiting alone, hindi yan warning sign. Dapat tuloy-tuloy na pagsuka. Clinical fluid accumulation, mucosal bleed, lethargy or restlessness, hindi yan additional. Liver enlargement of more than 2. Hindi siya more than 2 or equal. More than 2 centimeters. Anong ibig sabihin nun? 3 centimeters ang liver enlargement. Laboratory natin, increase in hematocrit. Concurrent now, partner dapat to. Increase ang hematocrit with rapid decrease in platelet count. And your thrombocytosis is increase ang platelet count. So thrombocytopenia. Okay, so nako, high yield yung warning signs na yan, not just in preventive medicine, but also in pediatrics and internal medicine. Now, I think this is my last question, just to emphasize the importance of rabies here in the Philippines. All of the following are considered under category 2 bite, except, yes, feel good question, para feeling mo naman tama ang last question, tama ang sagot mo sa last question. This is a minor abrasion on the face. Kasi even though it's a minor abrasion on the face, once na nasa mukha ang iyong exposure, automatic, it is category 3. So that's the end of my summary lecture. Hopefully, na-inspire ko kayo to study more.
Yeah, Doc, sorry, we have questions from the MGs, no? From other classes. Doc, after ng summary lecture po, Doc, can I ask po to have more examples regarding this Pearson R linear regression and multiple regression? Thank you po, Doc.
All right, sure. I'll help, pero I will also ask Mavi to focus on that. You can send all of your questions naman. Since we are already running out of time, and I don't want to overextend it kasi may QM pa kayo with Dr. Mavi and Dr. De La Rosa. I'll give them more time. Pero we will entertain all of your questions. Don't worry. Hindi pa po tapos ang ating PrevMed. Bukas pa po ang aming opisina para sa inyong lahat. And again, sorry, nasira yung line of thought ko sa aking ending slide, Doc Ian.
Sorry.
Nawala yung pamaalaala mo kaya akong verse ni Tita Charo. OMG. Stop share tayo. Ayan. So again, ano ba? And again, the end is near. Kumanta na lang my way. Galingan nyo pa, sipagan nyo pa. This is only the first time that you'll be reading the handout. So don't expect that you already know it. This is not yet the mastery period. We're giving you a lot of time to master it. Just appreciate on how we approach kung paano natin sinagot yung questions. Dapat ma-mimic nyo or matry nyo yung level of attack natin sa questions. And again guys, yung mga questions na yan, yung ibang pangalan, binago lang namin, pero yung konsepto, ayun na ayun yung lumalabas sa board exam. So kung ikaw ay nakakasagot ng tama sa mga tanong natin sa summary lecture, ibig sabihin you're on the right track. Ayan yung lalabas, ganyan yung lalabas sa board exam. Okay? So PrevMed is anything under the sun. PrevMed is hard. PrevMed is walang kwenta. PrevMed hindi patok. PrevMed walang patapon. It's on your mentality. And again, we are given a lot of time to study. We have 5 years of medical education. Use that. Comprehension, tapang, and again, bad trip ka na kasi pag 4th day. Pagod ka na kasi. Minsan, isipin mo naman, give PrevMed a chance. No? Sabi nga ni Bea kay Popoy, ako na lang ulit. So, good luck sa inyo and pa-screenshot, pa-group picture muna tayong lahat because we have Dr. Abraham here to say hi. Kompleto kaming PrevMed team. Do we have Dr. Virata pa? Ayan, open cam everybody. Thank you so much. I'm done with the summary.
Good evening, everyone.
Ayan. Paano kami, ayan, pasama si Doc Broly, si Doc Virata.
Wait, nag-on din ng camera yung mga students.
Ay, wag na mag-on yung camera yung mga students for data privacy reasons.
The teachers lang, guys, sorry.
Teachers.
Turn off muna kayo ng camera, sorry.
Ngayon lang nandito yung, okay
Wait lang.
Fans Ian
Spotlight. Wait lang, guys.
Well, you can open the camera. Pero get the picture lang muna, Ian, of the teachers.
Okay, sige. Smile.
For data privacy reasons.
Okay, 1, 2, 3, smile. Alright.
Okay, PrevMed team. Thank you so much.
Maraming salamat to the PrevMed team. Very good work. Louie, Mads, Mavi, and Michael. Okay? Guys, shoot nila yung mga videos ninyo very near the start date. Okay? Ni-revamp nila lahat. So I appreciate the effort. I think it was much better. Okay? And you're going to give the students a very good chance of getting a good score for this subject. Thank you so much. Okay? Next, Ian.
Okay, so let's proceed to our second half of the session. Okay, let me just share my screen. Okay. Can everybody see my slides? Kita naman. Okay. Sige. Let's start. Next question. Next question. Next question. Next question. Next question. Number 7. Number 8. Number 9. And last question, number 10. All right. So for tonight, help me welcome your quizmasters, Dr. Marian Michelle De La Rosa, a graduate of San Beda University College of Medicine, passed the PLE November 2020, currently a resident in Family and Community Medicine, together with Dr. Manuel Vidal, BS Biochem in DLSU Manila, rank 2, Chemistry Licensure Exam 2014, University of the Philippines, a graduate of the University of the Philippines College of Medicine, PhD in Molecular Medicine, University of the Philippines, Manila, visiting pre-doctoral research fellow, University of Texas Medical Branch at Galveston, Texas. Good evening, doctors. Are you here already? I guess you're already here. Doctors, good evening. Ayan.
Hello, good evening.
Good evening.
Hello, good evening. Doc
Taas
Mavi.
ng energy ni Doc ML.
Taas na energy.
Oo nga. Nagulat
Energy
ako.
natin. Oo, si Doc Mavi nasa ibang time zone yan. Puyat-puyat na yan siya. So game na ba? Ginalingan niyo ba yung pagsagot niyo? Ilaban na ba natin to, Mavs?
Laban na yan, laban na.
Laban na, laban. Okay, so yung mga tanong ko, ay, ano nang nakikita niyo?
Kadiliman.
Ayan, ayan. Tama ba? Nakikita niyo na?
Yes, Doc.
Ayan, perfect. So, yung mga tanong ko, ako yung first 5, si Mavi yung next 5. Very straight to the point, very straightforward. Talagang ano lang, gusto lang natin i-tickle yung mga minds niyo for tonight kasi nakarami na ng tanong si Doc Louie. So, dagdagan natin. Ayan, no? So, first, ayan, di ba? Sabi, itong daw si Ricky, hindi daw siya satisfied sa kanyang pamilya. So, nag-upgar ka. Tapos, ayan, ang chika 4 lang daw. So, what is the best answer sa ating live studio audience? Ay, yung mga TFC subscribers natin dyan sa, sa portal. Hello, hello. Sagot na lang kayo. Sigawan nyo na lang yung TV nyo or yung screen nyo dyan. Dahil hindi kayo makasagot ng poll. No? So nakikita natin, ginagalingan ng mga tao dito sa ating live studio audience. And the answer is moderately dysfunctional. Again, bakit ko ba ito tinanong? Sobrang basic. Kasi, ayan, no, uso yan sa boards na nililito nila tayo. Kung tatandaan ninyo, emphasize ko lang, sinabi ko na rin naman to sa lecture ko, no? Pero walang moderately functional. Either functional ka or hindi ka functional, 'di ba? Yung pagka-dysfunctional, yun yung kina-classify. So again, si letter B, never an option. It's never an option. Walang moderately functional. Either functional ka or dysfunctional with levels. Ayan. So tatandaan nyo yung 4 to 7, siya yung gitna, siya yung moderately dysfunctional. So again, review lang dun sa components, no? Si adaptation, mga keywords lang natin. Utilize and share inherent resources. Si partnership, sharing and decision-making and responsibilities. Si growth, dito yung desires or physical and emotional satisfaction. Affection is loving and caring, and yung resolve is yung commitment nyo to each other. Ayan, no? Sana lahat kayang mag-commit. And ganito yung itsura niyan usually, pero meron tayo, kung di nyo nalalaman, merong MAPGAR, merong CAPGAR, ganyan. No? So mas specific lang yung mga tanong para mas mag-grade, depende dun sa mga iba't ibang mga domains. Pero basically, yan din yun. Ayan. So for our second question, identify the family structure in the given scenario. So meron ng widower, taga White Plains, mga syala-syala yan sila. Meron siyang anak, si Robert. Tapos after 5 years na single na siya, single parent, ay pinakasalan niya si Anselmo na in love siya, ganyan. Na-divorce from Ayala, Alabang. So ayan, nagsanib-pwersa sila, nakaangat-angat na sila sa laylayan. And correct, the answer is B, blended, no? So, ewan ko kung naalala niyo yung movie ni Adam Sandler at saka ni Drew Barrymore. Panahon pa naman nila yun, di ba? Uy, di ba? Panahon niyo pa yun? Oh, basta ganun. Kung hindi nyo alam, pag nag-study break kayo, panoorin nyo yun, yung blended, no? So, basta kapag nagsanib pwersa ang dalawang broken families or dalawang single parents, blended family. Okay. Again, ang family types, no, iba't iba yan ng ganap. Merong size and structure, merong classified based sa authority, merong classified based sa residence, and emphasize ko lang to, no? Yung nuclear family consists of parents and their still dependent children. Kaya pumapasok dyan si single parent family unless may mga kasama si single parent na mga nag-aalaga kay mga children. So, nagiging extended. Yeah, ganun. And of course, tayo dito sa top-notch family, ano nga tayo? Communal family. Ayan. So, number 3, ang taas ng energy. Ano nangyari? Which of the following? Oh, bakit ka daw nagbibigay ng vitamin B6? Alin daw yung yung gamot na yon? Ang taas ng energy ko. Teka, baba akong konti. Okay. Ayan, no? So mukhang marami naman nakakatama ng sagot. Majority answered letter B, and that is the correct answer. Ayan, no? So, grab ko na rin yung opportunity na to na i-emphasize, emphasize sa inyo na yung bagong TB regimen sa 6th edition ng ating Manual of Procedures of the National Tuberculosis Control Program, National Tuberculosis Control Program, ay 2 regimen na lang. Dati kasi super dami, super nakakalito. Pero although nasa handout nyo yun, no, kasi baka nga itanong, kasi nga minsan nagre-recycle sila ng questions. So syempre, maganda, ma-familiarize nyo siya. Pero in clinical practice, it's important for you to remember, there are only 2. No? Regimen 1, yun yung 6 months, and regimen 2, yun yung 12 months. Ang important na maalala ninyo, yung 2 months na initial na phase or intensive phase ay parehas, no? 2 months na HRZE. Tapos nagkakatalo lang tayo dun sa maintenance phase. And basta kapag CNS, bones and joints, matic, regimen 2. Yan yung mga keywords, no? And kailangan nagpa-follow up. Ang ginagamit pang follow up ay DSSM. Okay? DSSM kasi doon natin nakikita kung buhay o patay ang mga mycobacteria. Because sa expert MTB-RIF, sinasabi niya lang kung meron o wala, hindi niya sinasabi kung patay. Ayun. And ito yun, no, yung important dun sa tanong natin. Important, bakit? Kasi itong mga side effects na to actually nakakapagbigay ng kumbaga nagiging basis kung nagiging compliant ba yung mga patients natin o hindi. Kasi minsan pag nakakaramdam sila ng mga side effects, hindi sila nagpo-follow up, tinitigil lang nila kasi ay sumakit yung tiyan ko eh, o ay nagmamanhid-manhid ako eh, ganyan, no? So it's really important na maintindihan natin to not only for the board exam but also for practice para ma-advise natin yung patients natin what to expect, and na if ever na maramdaman nila itong mga to, they need to tell you, they need to go back to the TB docs facility so that we can advise them properly. No, yun siguro yung talagang reason kung bakit ko shinare to. And again, yung mga peripheral neuropathy natin due to isoniazid, pyridoxine lang, laban na laban. Okay, 4th question. Ay, bakla. Okay, so nakita na po natin yung mga sagot. I'm sorry. Oo, no. Ayan. So, kunyari hindi nyo nakita, ano kaya yung sagot? Ayan. So, launching family, correct. Sige, ilaban na natin yan. Launching, kasi remember, when you are launching, dyan pumapasok yung si children, lalabas na, tapos itong mga children na to, magkakaroon sila ng family, mag-reintroduce lang sila so that you will get to know, etc., etc., di ba? Yung mga ganon. So, marami talagang mga development ng adult-to-adult relationships kasi nagmamature na rin, or matured na kasi yung mga children at this point. But remember, please do not forget na ang pagde-determine kung nasa ang family life cycle ng isang family ay based sa index patient, no? Para hindi nakakalito. Kasi kunyari, tingnan nyo yung family tree ko, ganyan, di ba? Hindi, wag ako kasi hindi. Basta, unattached yung adult ako technically kung ako yung titingnan nyo doon sa family tree namin. Pero kung yung nanay ko ang titingnan nyo, pwede na launching, ganyan. Kasi doon pa ako nakatira sa bahay namin. Pwedeng ganun, no? So, depende. And important, no, na matandaan natin na nagpa-progress tayo sa isang family life cycle based sa nagiging orders of change, especially kapag na-fulfill na natin yung second order of change. Okay? So, kasi nagbabago tayo o nag-change ng mga roles. Ayan. And my last question. Number 5, which of the trans-theoretical model of change is characterized? Ayan, kaya yan. Usually, ito ginagamit talaga sa smoking cessation, pero pwede talaga siyang gamitin in anything na merong behavioral changes na kailangan gawin. Diba? So, alin nga kaya yan? Kapag ikaw, desididong-desidido ka na ito yung action step mo na gagawin mo doon sa problema, nasaan ka na sis, pero hindi mo pa ginagawa. Ayan. So, ikaw ay yes, correct, ang ating mga live studio audience, nasa preparation. Ay, ano nangyayari? Sa preparation phase. Ayan. So, just a review, no? Ito yung ating trans-theoretical model or stages of change. Tandaan ninyo na itong mga to, it doesn't necessarily need to be like super tuloy-tuloy, but meron talaga mga parts na nagtatagal sila. No? That is why as primary care physicians, as family medicine physicians, for those na interested, no? Important yung tinatawag na motivational counseling because motivational counseling actually helps in pre-contemplation, in contemplation, and also in relapse. Because remember, for every relapse, there is warning. No? Hindi dahil nag-relapse ka, ibig sabihin failure ka. But you need to be able to understand what happened, why was there a relapse, ano ba yung mga naging reasons or naging causes. So, hindi yun ganun ka, yung motivational counseling, hindi siya ganun ka adaptable sa preparation, action, and maintenance. Kasi dyan sa parts na yan, laban na yung pasyente. And with that, thank you. Back to you, Doc Ian. Si Doc Mavi na yung next.
Okay. Ang taas-taas na energy ni Doc MM. Para tayong nasa 9 p.m. na, pero para tayong nasa noon time show.
Ay,
Doc Mavi,
ano ba?
can you
Ano
stop
bang
sharing?
Kayanin
Ano
mo,
bang-
Mavi,
ano bang-
kahit na hindi
ano
ka
bang
pa
vitamins?
natutulog.
Ano bang
oras
vitamins
dyan
mo?
sa Texas,
Pahingi
Doc
naman.
Mavi?
Kakagising ko lang kanina.
Kayanin mo, Mavi.
AM dito.
Tama,
Ano bang
tama.
vitamins mo? Pahingi naman.
Sabi ni Doc Louie, may bendazole. Okay. Sige, take it away, Doc Mavi.
Na-share na ba yung screen ko?
Yes, visible naman.
Hi, hello everyone. Sorry, hindi ko match yung energy ni MM. Pero, so 5 questions now na regarding biostatistics. So, dun tayo sa first question. Ito medyo mahaba to, no? Meron daw OB, no? Tapos yung disease of interest daw ay ectopic pregnancy, no? Tapos may panibago daw siyang test for diagnosis, yung Gangnam test. Alam mo, sabaw din ako ginagawa ko to. So, yung prevalence hindi 5% in the Philippines, no? Tapos in-apply niyo daw yung test na yon to 100 pregnant women, tapos 80 daw yung positive yung test, no? Tapos meron daw 400 na normal naman yung pregnancy, although 60% yung positive dun sa test niya, no? So the specificity of the test is so I think na medyo makonti lang yung oras, no, para sagutin yung question. Pero the correct answer for this one is 85%. Okay? So sige, isa-isahin natin yan, no, kung paano tayo napunta dun sa answer na yun. So remember, again, in-emphasize ko ni Doc Louie, no, na kailangan, pag meron kang question about screening sensitivity, gawa na kagad kayo ng contingency table, no? So, ano lang yan, yung yung columns ninyo would be disease and non-diseased. Tapos yung sa rows naman ninyo ay positive or negative, no? So remember yung ating mga formula, no, for evaluation of a screening test, it's going to be A over A plus C. That is your sensitivity. D plus B would be your specificity. A over A plus B, that's your positive predictive value. And D plus C plus D is your negative predictive value. So for this question, interested lang tayo with the specificity, right? So, balik tayo dun sa question. Sabi daw, meron ka daw 100 pregnant women diagnosed as having ectopic pregnancy by the gold standard. Okay, so lahat yan 100, no? Tapos, meron ka daw 400 pregnant women who have normal pregnancy. Okay, so yan yung totals natin, no? And then, yung next, mali yung nasa taas. Kapag sabi daw niya, meron ka daw 80 na positive yung test, no? So you substitute A for 80 dun sa true positives sa true positives, and then 60 daw yung nag-positive doon sa may normal pregnancy. Okay, so that's gonna be a 60, no? So para lang makuha natin yung mga values dun sa C and D, of course, you would subtract them, no? So magiging 20 yan, saka 340. And again, remember, specificity, it's gonna be your true negatives divided by your true negative plus your false positive. Okay, and that's gonna give you 85%. Next. So you are presenting the most common etiologies of preterm birth in an international conference. Which is the most appropriate graph? Madali lang to, guys, ha? Right. So the correct answer for this one would be letter D. Okay? It's a pie chart. Syempre, kasi remember, kapag meron kang question regarding regarding percentages or proportions, or pwede natin siyang i-represent as a whole na 100%. Kasi ang tanong dito ay common etiologies of preterm birth. So parang yun yung common mo, yun yung general subject mo, no? And then since meron kang mga subtypes dyan, then you would use a pie chart, no? So kunwari ito, actually this was taken from an actual journal article, no? So pie charts can be used to illustrate relative frequencies of categorical data, no? So the sum again should be 100%. And usually for easier visualization, meron kayo multiple colors na ginagamit, no? Again, sabi din kanina ni Doc Louie na may mga nagsasabi na kailangan 5 lang daw yung categories or less. But then again, it would not limit you actually with the actual number of categories that you need that you need to use, no? As long as kailangan talaga siyang i-represent. So let's go about the other choices, no? So one would be the histogram. So a histogram, it's used to demonstrate frequency distribution. Now, the rule for using a histogram is that your horizontal axis should be the variable of interest, and it should represent the true limits of your interval data, no? So kung titignan niyo dito, wala kang true zero, no? Kasi wala ka namang zero height. And then the minimum for this data set, the minimum height was 5. And so equally divided yan into different intervals. So yung vertical axis niyo naman should represent yung distribution niyo, no? Either numbers yan or frequency. And then the vertical axis should begin at 0. Kasi since frequencies yan, then meron kang i-expect na may mga data points ka na magiging 0 eventually. And so that's for your histogram. So line graphs, they are used to represent continuous data over time, no? So parang trend line. And the bar chart is to depict the frequency data of nominal or ordinal data, no? So next, the association between low birth weight and maternal smoking during pregnancy can be studied by obtaining smoking histories from women at the time of the first prenatal visit, and then subsequently assessing and assigning birth weight at delivery. So yun yung keywords ninyo, no? Okay, so very good. Most of you got it correct. So it's a prospective cohort. So balikan natin yung question, no? So the study, it's going to be a prospective cohort kasi remember yung subjects ninyo, yung pregnant women, they were categorized based on, on exposure to a risk factor, no? Smoking during pregnancy at the first prenatal visit. And then you follow them up, no? Until they give birth to the baby. And so it's going to be a prospective cohort. Yung mga clinical trials natin, prospective cohorts din sila in a sense, no? Pero kasi in this case, smoking kasi yung exposure or intervention. Siyempre, unethical yan, Brad, kung mag-a-assign ka ng isang group na, oh, nanay, mag-yosi kayo for the next 9 months, so tapos tignan natin yung magiging resulta. Bawal yun. So it's not gonna be a randomized controlled trial, no? Pag case control ka naman, remember, meron ka ng outcome kaagad, no? Alam mo na kaagad yung low birth weight and normal birth weight, and then looking back, you would check whether smoking would be present in either two groups, no? So kapag retrospective cohort naman, it's similar to a design to a prospective cohort, no? Pero ang difference lang niya doon sa simula pa lang, alam mo na rin yung exposure and yung outcome, no? Tapos titignan mo na lang sa records, no, kung classified ba sila as smokers or non-smokers. So yung difference niya with a case control is that your controls are matched with your cases, no? Sa retrospective cohort, hindi kailangan sa cohort hindi kailangan naka-match yung mga cases. Okay? So next, number 9. You are undertaking a study to characterize the frequency of somnolence. So you ask your patients to rate their level of somnolence within a 24-hour period. So it's never, sometimes, usually, or always. So which data scale? Right, so very good. Most of you got it correct. It's an ordinal level of measurement, no? So usually, no, napagbabaliktad natin yung mga nominal and yung ordinal scales, no? So kapag nominal yung variable mo, then you can have more than 2 possible values, but wala kang ordering. Pag ordinal ka naman, meron kang ordering. Pero kasi your ordinal variable, you do not have a quantitative way that would allow you to say that any distance between two data points would be possible, no? Parang sabihin natin meron kang murmur grading, no? So yung murmur grading ninyo, it's classified as grade 1, 2, 3, and 4. So and so on, no? So yung variables ninyo doon would be numbers. Pero wala kang true numerical value in between those order scales, no? Hindi ka pwede mag-differentiate ng 1 and 2, and so remember lang, sorry, that's interval. Sorry, nagkamali ako. So ordinal, yung ordinal natin, sabihin natin it's a grading scale also, pero hindi mo sila pwedeng ma-quantify. So ang difference niya with your interval scale, ordered din sila, no? Pero meron kang real numerical units, but they cannot be subtracted from each other, or you cannot divide them from each other. So yun yung difference between ordinal scale versus an interval scale, no? So yung interval scale niyo would be murmur grading. Wala kang clear difference between grade 1 and grade 2, no? Pero qualitatively mo lang siyang masasabi. So that's ordinal, no? Pero kapag meron ka namang date of birth, for instance, no? Ordered sila, 1971, 1972, pero kapag sinubtract mo sila, meron kang meaningful number. So pwede mo sabihin na 1 year in between. So that's mag-a-add ka lang ng 1, di ba? So ratio scales naman, they are measurements, no, in relation to a clear 0 point. Okay, so pag ratio naman yung scale ninyo, then you can meaningfully divide those values within the scale, just like weight or height or platelet counts. Okay, so yung usual na example ay temperature, no? So kapag temperature, kapag Fahrenheit ka, that would be an example of an interval scale. Pag Kelvin naman, that would be an example of your ratio scale. Okay? So last question, to estimate the average work experience of residents in a tertiary hospital, so you select 5 residents from each year level. So this type of sampling is called okay, so tapos na ba? Sorry, hindi ko makita. So most of you got it correct. No, it's stratified sampling. So daanan lang natin yung probability sampling designs. No, it's these are different illustrations of how you can go about thinking about your probability sampling designs. No? So isa-isahin natin yan. Yung one, ano yung sampling design ng one na yan? Yung first figure. No? You can type in the chat box. So it's, yes, very good. It's simple random sampling. No? So bumili ka lang randomly kung sino yung mga gusto mong maging samples. So that's your simple random sampling. Yung next figure would refer to what? Probability sampling design. Yes, very good. That's that illustrates a cluster sampling design. No, so you group them, no, according to a pre-specified criteria, and then you select the entire cluster. Again, yung mnemonic ko doon, I mean, pag inisip ko isang buong dakot yan ng groups, no? So that's your cluster sampling. Yung third naman, oops, sorry, napakita ko na. It's systematic. So systematic would refer to a specified interval, no, called K, and then you divide your total number of population by the interval number, and then you select for each interval using that number. So for instance, here, nag-start siya sa number 2, no? Tapos nag-decide siya na every second subject, yun yung isasama niya sa sample niya, no. So regardless whether lalaki yan or babae, hindi niya sinratify yan according to that, but he stratified it with regards to a specific K interval. So yung last natin ay it's a stratified sampling. So yung stratified sampling naman, nakita nyo, naka-group sila based on a criteria, pero hindi niya kinuha yung isang buong group na yun. But kumuha lang siya ng isa per subgroup. Okay? So that's the difference between your cluster sampling versus your stratified sampling. Okay, so pag cluster, again, remember, isang buong group, no? Pag stratified sampling, isang subject lang per group. Okay? So, daanan ko lang ito mabilis, yung correlation versus regression. No? Remember, yung correlation ninyo would refer to describing a relationship. So, imagine gusto nyo magtayo ng cafe. So, syempre, kung magbebenta ka ng kape, Brad, iisipin mo kung ano ba yung mga factors mo na pwedeng mag-affect doon sa sale nung kape mo, no? So, pwedeng yung isang variable mo would be the sales, no? And then yung products mo and then versus other factors such as weather or consumer income, pero hindi necessarily that your sales or these factors would affect this, would cause yung increase ng sale ninyo. It's just describing a relationship. Whereas kapag regression ka naman, you can predict, no? For example, you are thinking how would rainfall, no, would cause an increase in your growth rate, no, of your vegetables, sabihin natin. So here, no, in this example, yung rainfall ninyo would directly cause the growth of plants, of course, naturally. No? So that would be a regression. You can predict versus in correlation, you can just describe. Okay, so I think if you have further questions for those, no, okay, you can message me or Dr. Broly, and then I can just send a sample slide for this additional explanation. So yun lang, thank you. Also,
Doc, we
I'll
have
turn this over
questions.
to...
Are we gonna entertain questions ngayon?
Mhm.
So, hello Doc, okay lang po ba ipa-clarify ulit kay Doc Vidal yung regarding, sorry, yung regarding po sa grading ng murmur being an interval data. Thank you po.
Ibalik tayo. O mga anak. Wait, wait lang. Basta na ba yun?
Sorry.
Okay lang, okay lang. Sige. Okay, so mga anak, no? Pag sinabi nating ordinal, it's a categorical variable, okay? So kapag yung categorical variable na yan, meron siyang specified increasing ranking, no? So sabihin natin cancer staging. Sabihin natin cancer staging. So it's gonna be stage 1, stage 2, stage 3, stage 4. Alam natin na increasing yan, no? Pero you cannot have a quantitative way of saying that stage 2 is double the intensity of stage 1. Gets? Hindi nyo pwedeng masabi na ganun. Kasi nagde-describe lang kayo. So that's ordinal. Pero kapag interval ka naman, no? Meron kang pag sinubtract mo yung rankings ninyo, then meron kang makukuhang meaningful value for it. For example, it's gonna be height. So, maybe let's say, yung example ko na lang kanina, birth year. So sabihin natin pinanganak ako noong 1993, no? So ngayon ay 2023 na, no? So pwede kong sabihin na I'm already 30 years old. So yung 30 years old na yan, meron siyang meaningful value. Kasi alam nyo na it's gonna be 30 years after 1993. So that's gonna be your interval variable. Versus kapag sinabi nyo sa cancer staging na, hindi nyo pwedeng sabihin na plus 2 stages above. So, or plus 1 stage above. So hindi nyo pwedeng sabihin na twice yung intensity ng cancer stage 2 versus stage 1. Or grade 1 versus grade 2 murmur, and so on. Did that make sense?
Okay, Doc. Tapos yung may isa pa tayong question. Can I ask po, Doc Vidal, an example of a retrospective cohort po?
Okay, so for example, wait, punta lang ako sa slide niya. So, retrospective cohort. So, paano, kunwari ito, no? Paano natin siya i-convert into a retrospective cohort? So, one way in which you can convert this study, this prospective cohort study, to a retrospective cohort is that when you did the study, exposure and outcome has already occurred. And then, pag titignan niyo yung clinic records niyo, yung charts niyo before, kung sino yung, titignan niyo kung sino yung classified as smoker and non-smoker, no? Then you are looking back into time already. So that's how a retrospective cohort works. Versus a prospective cohort in which you only have an exposure and then hindi nyo pa alam kung ano yung magiging outcome ninyo because you will follow it up in the future.
Okay, so we still have some questions here. I think I should direct the other questions to Doc MM or Doc Luiman. Ayan.
Hello-y!
So for the family life cycle, ask ko lang po if hindi po dapat family with young children yung answer sa question kanina since my 9-year-old pa po na youngest child. I think this is for Doc Louie.
Hi, yes. We try to value kung sino yung highest age na pwedeng pumasok doon sa life cycle. So kung mapapansin mo, yes, meron ngang family siya with the young children, pero i-take note mo na may adolescents na doon. So ayun yung next na answer. Kung sasabihin mo sa akin, Doc, may 22 na. Kasi nga, hindi pa na-achieve ng 22 years old na, na ma-launch siya, na umalis siya from the family unit. Kaya ang best answer pa rin doon is family with adolescents.
It's
Okay, thank
always
you, Doc.
contextualized talaga.
Okay.
Contextualized.
Another clarification, Doc. Bakit hindi po permanency yung answer kanina since stroke is a permanent disability na po?
Well, I will share my sentiments with that kasi nga early onset siya. So, hindi ka pa pwede doon sa pinaka-last stage na 5. Ikaw, Em, what's your take about that?
Usually kasi,
Paano discussion na to, no?
FGD. Hindi. Hindi kasi, remember, kaya nga di ba, ang tawag dun sa 4th stage ay early. Early adjustment to outcome. Usually, dito pumapasok yun nga, kakadischarge pa lang niya sa ospital or kakatapos pa lang ng major na therapy na hindi pa totally na-anticipate or hindi pa totally nag-sink in kung ano yung outcome na either partial recovery, yung return to full health, or may permanent disability. Ngayon, pag dumating na sila sa point na ang tawag mo dyan, eto na, mukhang pang long term na to, stroke na talaga siya, hindi na talaga siya makakakilos, ganyan. Stage 5 na yon, no? Ganon yun siya. Kaya nga 'di ba, kung matatandaan niyo sa lecture ko, sinabi ko rin na minsan sa ibang references, si stage 4 at si 5, kino-combine na nila kasi yung delineation nila minsan arbitrary. But you need to be able to contextualize. Pag sinabi na kaka-discharge lang or kakalaman pa lang na na-stroke na may ganitong ganap, na ganito na lang yung kayang gawin. Yun. So, kailangan talaga medyo i-comprehend natin yung mga tanong. Ayan.
Okay, thank you. Next question. For this question po, Doc, pwede magpa-expound ng difference ng early adjustment and adjustment to permanency? This the student is pertaining to yung sa patient was discharged from hospitalization after having a stroke, and then the answer is early adjustment to outcome. I think this is for Doc Louie.
Iba yun na rin yung sagot doon. I think same question.
Oo, same question siya. I mean, ito na lang guys, ang rule natin. Tapos ipasok natin yung testmanship rule ni Dr. Broly. Kapag ang ating case ay early adjustment to outcome, pwedeng nasa konteksto pa na inside the hospital or recently discharged or na-discharge from the hospital. Kapag adjustment to permanency, ayan na yung na matagal na sa bahay, meron ng mga disability at usually meron ng end of pwedeng palliative. So basta ang word na lang natin is yung contact point from the discharge from the hospital para lang meron tayong common point, okay?
Okay, Doc, isa po, may clear-cut po ba na reason kung bakit po yung post-stroke hindi pwedeng stage 5? Or nasagot na rin to, no? Ito yung nasagot mo na, Doc MM. Good evening, Doc. Ask ko lang po regarding question number 5. I think this is for Doc MM. It mentions the patient is already taking some actions. How come hindi action?
Again, no? Reading comprehension. Charing. Hindi, ito, i-share ko lang ulit yung question para mailaban natin. No? Kung makikita mo dito, ang sinasabi niya is si individual may intention to quit. So intention niya rin tong mga susunod. Intention niya na mag-take some action, na intention niya tong quit smoking. Itong such as ay object nito, taking some action toward quitting. Gets? So ang keyword dito ay intention. Hindi pa niya ginagawa. Gagawin pa lang yan siya. Kaya preparation pa lang. Okay? Ayan.
Okay, good evening, Doc. Can I ask the difference of the 3 population pyramid? Di po kasi included in the lecture kanina, if okay lang po sana.
Yung expansive, yung I'll just
If the base is narrower po ba, does it mean a decreasing population? Parang follow-up question.
If the base of the population pyramid is narrow, meaning the fertility rate or the reproduction rate is low kasi mababa yung number of population when it comes to the base, which is yung lower age population. Pero we cannot definitely say if the population is declining. because in the population pyramid, we are trying to assess yung distribution of the male and female in the census or population.
Okay, I think this is the last question. Pwede po pa-clarify ulit ng sensitivity and specificity kasi nakakalito po yung spin and snout na mnemonic. Parang iba siya sa description sa handout. Thank you po.
Mavi, ikaw o ako?
Kahit sa'yo, Louie.
I have an explanation of that kasi baka malito kayo lalo kung i-explain ko siya out of the blue ngayon. Pero spin and snout kasi is just a mnemonic that you don't need to take it serious, na parang ayun na mismo na. Kasi ang spin is specificity when spin roll in, the snout sensitivity you roll out. Meron akong line dyan, I'll send it kay Doc Ian, promise. Kasi meron na akong statement dyan na mahaba.
I may humabol, Doc. Pa-clarify po sana ng difference ng retrospective cohort sa case control. Thank you po.
Sige, sa retrospective cohort, we are talking about the starting point is the exposure and then your outcome. So in-explain na kanina sa retrospective na nangyari na parehas. Meron ka ng identified mo na exposure, meron na ring outcome or disease. Ang case control naman, ang starting point mo is the outcome. And yung outcome na yon, kinakategorize mo pa with the case and the control. So you will identify kung sino yung mga with disease, which is the case. You identify yung mga walang sakit, which is the control. And then you will do a review. Somehow kasi, pabalik din it's not through time sila sumusunod. But this time, ang starting point mo, outcome, and then you will look for the association ng exposure. Kapag kasi superficial understanding, parang the same. Kaya nga ang lagi kong point of ano na sa inyo, reminder is you always try to identify the case. If the starting point is outcome, and then you choose case control. If the emphasis of the case is starting point na exposure, then you choose cohort. Now, if both already is available through records review, then that is a retrospective cohort. Ngayon, pag may time element kayo na finalo through time in 4 years, 10 years, 15 years, that is a prospective cohort.
All right, so I guess that's the last question. Thank you so much, doctors, Doc Louie Man, Doc Mavi, Doc MM, for tonight's
Nandito
very
pa ata-
energetic session. And of course, to my students who are also very energetic, equally energetic as our lecturers for this evening. Para tayo nasa noontime show. Thank you
Yes,
so much,
correct.
doctors, for joining. Doc Broly is Doc Broly is still here? Is Doc Broly still here? He's not here anymore. Doc Mads Abraham, would you like to say hi to the students? Nag-hi na ba si Doc Mads?
Andyan ba siya?
Yeah, I think
Yeah, she's still here. Hi, Doc Mads.
Hi, Doc.
Si
Thank
Doc,
you so much.
Ay, fresh.
si Doc
Sorry, Doc, kanina
Elvirata
galing
ba?
ng session.
Doc Elvirata, are you still here?
Si Doc Mads, nakauwi nakakot. Ngayon ba sana buhok, sana all.
Sana all.
Ayan, so congratulations, doctors, for reaching this far. No, nasa halfway na tayo ng program. All of the materials have been given already, mga handouts and main lectures. So we are already on to our midterms tomorrow, and then on to our mastery period and pearl. So konting tiis na lang, guys. Copy tayong lahat, guys, sa ating mga sarili. Aral lang, laban lang, guys. Okay?
Laban
Thank you
lang,
so much.
mga B.
Okay.
Fight
Thank you,
lang
everyone.
tayo. Thank you, everyone. Shout out sa aking
Shout out kay Fed.
babies.
Shout
Shout
out kay
out
Fed.
sa
Galing
aking
mo
mga
mag-aaral.
students from Visayas and Mindanao na
Shout out
sobrang
sa mga
energetic.
Jinsa and Ecos babies and UPLB peeps. And fight, mga bedan. Woo! Go, go.
Fed, galing mo mag-aral, Fed. Bye-bye.
Bye, everyone.
Bye, everyone. Thank you.
Thank you,
Ito po,
Doc.
no?
Thank you, Doc. Thank you, Doc.
Thank you. Thank you. All right.
Thank you, Doc.
Thank you, docs.